Good evening, everyone. This is the second subcommittee meeting on conference on the 2022 proposed budget. Officials invited to attend tonight: City Manager Tom Ambrosino, members of the City Council, Ed Dunn, Cheryl Watson, and I think for the second night we have, I gotta read this one. We have Drahika Ivanis, Diane Carey, Jeanette Citron White, Ned Keefe, Florida Maya, Tracy Nowicki, Francisco Toro, Sarah Jackson, Bia Cravata, Jim Sullivan, and Chief Brian Kais. The clerk will now call the roll of the City Council.
Councilor Vido, absent. Councilor Avellaneda.
Present.
Councilor Recupero. Councilor Garcia.
Present.
Councilor Vega Maldonado.
44.
Councilor Robertson. Councilor Rodriguez. Councilor Taylor. Here. Councilor Lopez.
Here.
Councilor Brown. Councilor Zabit.
Present.
Welcome back, Counselor.
5, 6, 7.
Thank you.
7 members present.
Hope
We
you're
have a
feeling
quorum.
fine. So tonight we will have, in this order, unless we make adjustments, we have procurement, personnel, employee benefits, city clerk, parking, health and human services, health officer, elder affairs, veteran services, library, recreation and cultural affairs, assessing, emergency management, and police. We'll start off with procurement, and we have Dragika, I want to make sure.
Yeah,
Ivanis.
yes.
And for the councilors, please turn to page 44 of the city budget, proposed city budget. You have the floor.
Good evening, everybody, city councils, Tom, Ed, Ned, Steve, and everybody else in this room. My name is Dragita Ivanish. I'm the Chief Procurement Officer for the Purchasing Department. I just want to have a little overview of what we do in the Purchasing Department. We approve on the daily basis most the purchasing activities for the purchasing and the rest of the departments for the city, which now when we are reviewing the budget and already approved CIP budget totals, everything has to come through my office, purchasing department, to be approved to make sure we follow the state and federal laws, and then we give everybody open and fair competitive procurement process, and ensuring the equal opportunity for all. Other than purchase orders, once we put bids out, proposals, qualifications, we put the contracts together for the city, we execute them. One of the big achievement for FY21 was that we started doing contracts electronically, and we are gonna make sure that in FY22 the contracts are done, most of the contracts and agreement through electronically to save paper. Another goal for FY22 is that we need to work on our contract database, one that we have right now. It serves us well, but is a little outdated, and that's a big goal for the purchasing department, to make sure all the contracts and everything related to those contracts are maintained and done well, and probably approachable and can be seen by other departments as well. Expenses, the salaries, it's usually 2 full-timers, Chief Procurement Officer, myself, and Head Administrative Clerk. That's, it used to be other position half-time back in 19, but we'll get to that when we get better times. Longevity affects myself and Head Admin Clerk. I been served with the city for 20 years and the head clerk for 10 years in FY '22. And sick bonus leave, it's for both of us. In expense line, we have advertising. By law, we have to make sure all the bids, proposals, or qualifications have to, by law, be advertised. So that line is most for the local Chelsea record. There is no change to it. Rent lease copier, there is a slight change seen in decrease, but that's because of the copier in our office. It's on the state contract that we purchased, and it's just for the basic that it serves us, and there was a slight saving there. Employee training, it's for myself to keep up the certification, which I have to be as a certified public procurement official, and the head admin clerk is also attending to get certified. And for me to continue those certifications, I have to keep up with credits and continue with the education, which is a big plus for both of us. Travel conference, we haven't done that in this FY '21. We'll see how things are gonna go with '22. If there are gonna be any offerings through, I am part of the MAPA Association Public Purchasing Officials, and they do attend a lot of seminars and classes. Other big expense in that line is office supplies. It stays the same. It covers most of its supplies that we oversee and centralize for the rest of the departments, and also covers purchase of ink for toners or small, not big supplies like printing, shredding, and so on. And the big contract for the contract DocuSigns that we are doing. Another one is for dues and subscription that covers the memberships that we have for MAPO. And that's it for the purchasing department. If you have any questions, feel free.
Councilors, no? Any questions? Councilor Recupero?
On your thing here, right?
What
The
thing?
longevity, right? It increased 111%. Why?
Because that's a
That's
contractual.
because of you?
I just mentioned 20 years, that's a contractual, and the other person, she's a full-timer, she's a 10-year, so it's a contractual by union.
But Council, the second person in that department, this is the first year for their longevity. She reached a 10-year threshold, so her amount of $600 is new to this budget. Drajika's increase is, as she said, part of the contractual arrangement, so hers goes up as her time goes up. So this increase of $1,000 is a combination of two things. It's a new person coming into the unit at that threshold, that first threshold for 10 years at $600, and it's an increase based on her time in service for
Another
4.
question here, too. I like this one. Your equipment maintenance went down 28%.
That's the copier machine in our office.
So what did you get rid of, equipment?
We did not, there is a company that we go by to lease the equipment for each office, and we do that through state contract, and some machines models went down, which affect our machine, and some machines went up for the lease, monthly lease that we do for the fiscal year.
Thank you.
You're welcome.
Any other questions? No other questions unless you ever make a statement. Tom, if you have anything to add?
No, nothing to add.
Okay. Thank you very much.
Thank you, have a good night. Thank you, Mr. Duff.
Our next, is Diane
Personnel.
Carey?
I think Ned went to get her.
Ned's
Okay.
gone to get her. I think she's down the hall.
We're turning to page
58?
58.
So councilors, there'll be two
Page
divisions.
58.
There'll be two divisions for Diane Carey to discuss this evening. The first will be the Personnel
Personnel and
Department,
employee
and then
benefits.
the Employee Benefits, yes.
So the first page is 58, the second one will be later on 171, but for now, we're on page 58. Personnel also titled, sorry, it's said here personnel, but it's human resources, as Council Brown has corrected me.
Hi. Okay, for those of you that don't know me, my name is Diane Carey, and I'm the HR Director. And the Human Resources Department provides customer service for our employees who work in various roles serving our community, as well as our retirees. The HR Department's responsible for recruiting, hiring, and onboarding new employees, benefits leave and salary administration, training and staff development, employee and labor relations, policy development and administration, and administering the Senior and Veterans Tax Work-Off Program for our homeowners. With regards to our personnel budget, our department salaries for fiscal year '22 are $307,650, and this is 22% higher than fiscal year '21. When our human resources manager retired in June of 2020, we left the position vacant to reduce costs during COVID, but now we're seeking to backfill the position. Our recruitment needs have increased, and as a result, our advertising line increased from $1,000 to $5,000 to accommodate this demand. And the training budget has increased from $10,000 to $15,000. With the addition of our DEI officer, it's the goal to provide employee training in support of this endeavor, such as implicit bias and compliance training, and to include non-harassment, non-discrimination, and other related training. And our accomplishments for fiscal year '21 included that we successfully rolled out and updated policies for exempt employees and employees not otherwise covered by collective bargaining agreements. And with the challenges brought about by COVID and working remotely, we used this as an opportunity to automate and streamline administrative processes. This included the implementation of online benefits open enrollment while introducing a new dental provider. We increased efficiencies by replacing a manual and cumbersome paper process for all new hire and employee changes by introducing and implementing DocuSign, which is an automated electronic signature form. And our major goal for fiscal year '22 is to implement the HR benefits module in Munis, which will provide accuracy and timeliness in reporting and further streamline efficiencies and offer employee self-service. Once implemented, this will eliminate the need for DocuSign expenses and reduce further compliance reporting costs.
Any other questions by the Councilor Recupero?
How come you advertise an increase 400%? What do you, what is that, 4% or just 400?
Well, the year prior, our advertising budget was $15,000, and during COVID, we cut that significantly to $1,000, figuring that during that time, we really weren't going to be doing a lot of advertising, but there has been the need to fill some positions, and that will continue, so we needed to increase that. But it's still significantly lower than it was a couple of years ago.
You have one position that's vacant. What's that? HR manager?
Yes.
You're going to fill that position, or you're going to just leave it alone?
It's the hope to fill it in September.
That's part of the proposal in this budget, is to fill that position, yes.
So this was a position that office, since I had been here, had 4 people. Alice retired right at the end of the year in fiscal '20, and to save money during the COVID crisis, we did not fill her position last year. But the office is extremely busy. They're very taxed in there with 3 people, and so that office does need a 4th person. We're asking the council now to restore that position, and we'll fill it hopefully this summer, and with someone starting right after Labor Day.
Council Taylor.
What is included in the medical services?
Let me pull that out. That includes testing for our police and our fire, the different testing that they undergo. It includes police, fire, pre-employment medical and psychological testing, and TB screens, random drug testing for our DPW staff.
Okay.
Yeah, he's,
Thanks. I see and I heard you talk about the increase in the training. Now, your training that you spoke about, can you tell us a little bit about it? Is it in-house or is it a specialized firm that's going to come in? And what type of training are you trying to
Well, the
implement?
training, we'll have to look at that with, onboarding of the DEI officer.
I'm sorry, I can't hear you.
I'm sorry, with the onboarding of the DEI officer,
Yeah.
I'll be working with her to take a look at what that involves. I would imagine it would be a little bit of both. And then also
So
cost
you
for
mean
material.
some in-house training and
Yes,
also some
yes.
professional? Yeah, okay.
Mhm.
All right. Do you have any ideas of, without her, what you would like to do or what you would like to try to address?
What I definitely want to roll out again is sexual harassment, non-discrimination, non-harassment training for starters as part of the compliance training.
Okay. Have you had a lot of those complaints in the past 2 years?
They come up from time to time, and it's good practice to actually conduct that training every couple of years.
Make people aware of the sensitivity and,
Yeah.
the jokes that used to be accepted are no longer accepted. Okay. Thank you. Thank you, Mr. President.
Councilor Lopez.
Can you explain on other consultant services, $28,000? What was that about?
Are you referring to the other professional consulting services?
Yeah, what?
Okay. Some of that is for the arbitration and mediation, the unemployment contract, that's managed by an outside consultant. We also have compliance reporting for the Affordable Care Act, or ACA, through a vendor, and that comes out of that line item as well. And right now, with the Munis implementation, some of that is coming out of our line item. DocuSign is also an expense that comes out of that line.
Also, can you explain also on the temporary staff, $20,000? Is that outside contractors?
Those are
People that
staff that we bring in on a temporary basis to fill a need. They're on our payroll. And so that, if we hire temporary staff in other departments, that will typically come out of the HR temporary expense line.
So sometimes we have a need in an office, it gets busy, we need to bring someone on board. The union contract allows us to bring someone on board on a temporary basis for 6 weeks before we have to go to the union and hire a permanent. So sometimes we'll bring on a temporary employee for a very short period of time just to get through a project. Other times we use this for interns in the summer. Kids from college want a job, they want to do something, we'll use this line to pay them, during the summer.
How do you hire this temporary staff? You put an ad in newspaper, or is this office with the staff that they supply personnel to you?
It depends. It may be an employee referral. They're most, I would say, all Chelsea residents. It may be word of mouth. We may put an ad in. I'll be putting in an ad for a couple of temporary workers And that'll go out on our, I'll send it out to all of you probably within the next day, and also that'll go on our website. So, yes, we do advertise as
Usually
well.
we try, if it's
Yeah.
going to be a temporary employee, we usually try very hard to hire someone from Chelsea. If they're college interns, sometimes the school reach out to us with someone that they're looking to get some work for. Those sometimes aren't necessarily Chelsea kids, but it's a school program and they're trying to get a placement for someone. But if it's someone we're looking to bring on in a short term, we almost never go outside the city of Chelsea for that.
Thanks. Awesome.
Any other questions? Seeing none? Thank you.
Okay, thank you.
You've got employee benefits.
Oh,
Employee benefits.
So page 171.
On page 171, it'll be the first grid on that page. The bottom grid will be discussed tomorrow night on retirement.
$171. Okay.
any questions?
Okay, so this employee benefits section is overseen by the Human Resources Department. It includes the health insurance costs for all of our employees, life insurance, Medicare, workers' compensation. So the Medicare cost is 1.45% of an employee's pay, and that is funded through this department. The city's share of that comes through this department. Workers' compensation costs, that would be borne by the HR department in the event that that is necessary for a worker who is injured on duty through DPW mostly, and occasionally through fire and police. The unemployment cost remains stable in and around $30,000 per year. So this particular part of the budget is for employee benefit classifications that's mostly overseen by the HR department. The Medicare would be that one exception that comes through the payroll department. Have any questions on?
Councilor Taylor?
Under the workman's comp, there's a 14.5% increase, $60,000. I'm just curious, is that because there were recent accidents that have happened? So you're seeing that level of an increase. I know that because of COVID, usually the workman's comp prices have gone down. So it's kind of counterintuitive that you'd see a 14.5% increase.
That one's always a difficult one to predict, unfortunately, because we don't know exactly what our expenses are going to be. It's a prediction or an estimate. We did have a couple of settlements this year, so that'll come out of that line item. On the city side, we're waiting for one right now. We also had another settlement not too long ago that, these are things that best laid plans sometimes that come up. And also, we did have one particular claim, which was a worst case scenario, that was $7,200. So based on that projection, it's hard to predict. So we wanted to build that in as well.
This
Yes,
line item
it's
is a
a
bit
tough
of a
one.
crapshoot. We try to give our best estimate, but employees get hurt all the time. Police and fire get hurt. They get their full salary, but this line item picks up their medical expenses when they're injured.
So just remind me now, since, sorry, I'm relatively new counselor. So
We're self-insured.
self-insured,
Workers'
that's what I thought.
Yes, yes.
And so there's nothing that actually is going to drop off any policy or anything. We're just
No.
basically guessing.
Yes.
We're sort of guessing based on our trends and what's.
I mean, you still have to pay the settlements to these
Yes.
people,
Yes.
and I'm assuming that that's gonna be over a period of time.
Yes.
So it's, I mean, it works the same way as an insurance policy would, but it's,
But it you know, it's not a steady payment as if you were in a workers' comp insurance situation. And I know that fluctuates each year as well. But most cities and towns are self-insured for workers' comp.
I was just curious because of the increase, and so, you know, not many people were really out working during the pandemic, so why would there be a 14.5% increase?
But our
Yeah.
people were working
Yes.
for the most part. You know, the people who get injured on are typically police, fire, DPW. Those are where we see our injuries.
Yeah.
And, you know, as I said, police and fire, they get paid their salary, so that's not coming out of here.
Yeah.
But their medical expenses are coming out of this. And for other employees that get injured, this is where the payments are coming from.
Okay.
Councilor Recupero.
I have a question. On your Medicare, right, it increased 0 point from 490 to 492. That's for employees that are over the age that the city changes their Medicaid. So what is that, Medicare? Who pays into that? If we have, we're self-insured, why do they pay Medicare?
That's the payroll expense. So there's a Medicare percentage, 1.45% of pay, that is assessed to the city, which is a matching 1.45% that's taken from employees' pay. So that is taken from this line.
So that's a federal thing, you have to pay it regardless of what it is.
Correct.
Well, it's a function of what the payroll is. So whatever our payroll totals are, 1.45% of that is what the cost is to the city for the Medicare expense.
So that means the people later on, when they retire, they can go on that. Like when they reach 65?
That's a separate determination. So this 1.45% is a required federal tax on employers. We have to pay this per our total payroll. Individuals also pay a tax for Medicare, and to qualify for Medicare, you do have to meet certain other requirements. Some of our employees meet them, and some of them don't. You have to have so many quarters in the private sector. I believe it's 40 quarters in the private sector in order to qualify for Medicare. If you don't qualify, we will still move you into Medicare, but we will pay a penalty.
So the city will cut the difference, even if they don't qualify?
We have a PEC agreement that requires us moving people into Medicare, whether they qualify or not, and if they don't qualify, we pay a penalty to move them in.
Is that a choice to them, or the city force them?
The city, it's no choice anymore. Pursuant to our PEC agreement, they are required to move.
So when they become...
The unions negotiated that provision.
So that means when they get older, right, your health insurance on the city disappears and they move into that system?
No.
You still have health insurance from the city. You get a Medicare supplement plan typically, but you'll be moved into Medicare Part A.
Automatic, they'll put you there automatic.
We'll move you into Medicare when you qualify, when you
Or not.
reach age 65.
Thank you.
Regardless of whether you have enough quarters.
Okay, thank you.
Councilor Taylor.
So my other question was in regard to the pensions. Down here,
So we're not on that, but we can do that because pensions are simple. So why don't we cover it and we won't have to do it tomorrow night?
okay, sorry about that.
That's
I'm
all right.
skipping
Ed
here.
is
It's on the
here.
same section
Yeah,
here.
so we can do it. So if you want to just quickly, so this is a number that we get from PERAC, and they tell us this is your required contribution to the system. And Ed is on the retirement board, he can describe further, but these are set prices.
Based on an annual report that is submitted from the retirement department to PERAC, our oversight authority on the retirement system, and they in turn analyze and provide us with the cost of our contribution. That's split between the city and the schools. So what you see here, this $9 million number is the city's portion. The school would have presented their portion, I think, last night in their projections. The smaller number, the 11,000, is a non-contributory piece. That's for one individual who does not qualify for the retirement based on the age of that person. And so that's going to, at some point, change. But at this point, it's projected to be $11,000.
Can you go into the, just briefly and generally speaking, why 9.4% increase? What's involved in the increase? And I see a kind of almost a similar.
I think it's based on the number of employees that PERAC sees as active, and those that participate, because the part-time employees don't. They're in VOIA, which is a separate program.
Yep.
So the retirement department director submits a report to PERAC at the end of every year that shows the number of people and the salaries of those people.
So it's just a function
It's a
of
function of
how many people
there are,
retired,
what their
and
salaries are, and I don't think it has anything to do with what their age is. It's active employees.
But there are two components to this number. One is the actual cost to pay retirees, what we owe them for next fiscal year, and then we're paying a chunk of our unfunded liability. The difference between what we have in assets and what we owe all our retirees. And we have to close that gap to zero in the next 7 years.
Yeah,
I think our payment
2029.
schedule ends in 2029.
that's what you said.
So we
last
talked
time.
about that last night when
Yeah,
we
right.
looked at the
I remember.
OPEB cost, and that's also, Tom is right, that's a function of this as well, which will drop off from this, but you'll see it on the OPEB charge later.
So we can basically, just so I understand this, we can basically see then, it sounds like we're going to have mostly increases from here on out. right?
Absolutely, for the next
From-
7 years,
until-
significant increases each year until we pay off the unfunded liability. And then there'll be a cliff where we're going to save
And this is
$14 million.
basically on your schedule, or it's based on
It's a
the-
retirement board schedule,
Okay, but it's based on paying that off by 2029.
correct, which is not mandated by state
I
law.
understand.
You can now, I think, go out to 2040. But cities and towns usually reserve that leeway for dire circumstances. This is one sort of cushion you have, where if you're in dire straits, you can extend the payment
This
schedule.
is one of the things that kind of makes me worry about spending, you know what I mean, in general, is this issue of pensions, and so, you know, I think, trust me, I'm all for closing the gap, so.
As I mentioned last night, this transition of all our retirees to Medicare, regardless of whether they have sufficient quarters or not, is a decision that will bear great benefits to us in the future, because our OPEB liability should, if it's not going to go down, is definitely not going to be escalating like it previously was.
Right, okay, thank you.
Councilors, any other questions? Seeing none? Thank you, Daniel.
Thank you.
We'll now turn to City Clerk, page
67.
67.
Thank you.
Thanks.
Yeah, yep.
So there will be two divisions here that Jeanette Cintron will speak on, the clerk's budget and the parking department.
So I'll go over the city clerk's budget first. So as you know, we're responsible for vital records, that's death, birth, marriages, all aspects of elections, that's local, state, federal, and the local census or street listing, and this year will be my first federal census re-precincting for 2022. We do dog licenses, business certificates, zoning decisions. We're the record keepers for the city, oath of office, open meetings, conflict of interest, acknowledgements, and certificates. As you can see at a glance, we took in over $73,000 for certificates and licenses. One of the key accomplishments I guess I will most proud of is the election during a global pandemic, and thank you for your words. I heard you at a meeting. So we're very proud of that with the help and support of DPW and the city manager. And then one of the goals and initiatives that we're most proud of is, or we want to continue working on is scanning the city council meeting documents. So in my accomplishments, I did mention that we did do from 1989 to 2017. Fatima and Kimberly, the greeter at the door, they were actually able to get 2018 to current, almost current. So those are archived as well. They're accessible, searchable. So we want to keep that going from before 1989. And so I will put that submission in CIP later this year. And then in our expenses, salary and just the operations, there is only a 1% difference. We did ask, we didn't make any changes. Obviously due to COVID, it's not accurately, our year is not accurately reflected. So we kept that the same. And then as far as personnel, everyone's the same as far as city clerk, assistant, and the senior clerk. But the floater position that was previously held by Fatima is recently filled by Kimberly, the greeter. So we actually promoted her, and she started on May 3rd. So the funding was there, and we were able to fill it, and she's doing a great job. So that's just the overview of the city clerk side.
Jeanette, one of the things that was discussed during our charter review was either the original was a attempt to move the election day from a Tuesday to a Saturday to get more people, and then the conversation has since turned that in reaction to the early voting that was implemented by the state and is going to continue, that a similar option be considered for the city elections, that they be consistent with what the state does locally. My question is that, one, what are any conflicts that you foresee? And two, what kind of impact would that make on your budget?
So a couple things. So Saturday typically is towns. I don't know of a city who does Saturdays, so it's typically a town, so I would have to look into that. I have...
Not the change, but the expansion. If we were to, if the city council was to implement and say that they wanted to have early voting, just like we did during last year's election, from the Monday of the previous week until Saturday, with a one break on Sunday, a break on Monday, and then back to election day on Tuesday.
We have to revert to the state laws, so Mass General Law, so even those temporary and some permanent laws, the 2020 laws due to COVID, election laws. So early voting has to end the Friday before the election. So the Saturday before the election is not an option, it would be the Saturday before that. And you can, but right now, we did look into that with Michelle Tessanari from the state. Those laws expire June 30th, so they were only implemented due to COVID. there is legislation out there to make that permanent, but it's not effective as of yet. It hasn't been passed. And so as of right now, all those changes expire on June 30th. So I don't have any more information, but I was told that we cannot make those changes. It's not an option for municipalities because it was due to COVID last year, and we would have to allow for the legislation to move forward on that.
Was your question, assuming you could get past the legal hurdles and the legislature allowed for a municipality to do this, what would the financial impact be?
So
I think it's probably just overtime.
yeah, so I think it's more of an overtime. So if we were able to do it, if we had the election before June 30th, it would just, we've done this before, but we would follow all the rules, which is you can do it up to the Friday before. We usually offer a Saturday. We do it by law. We have to do it Monday through Friday is the hours of City Hall.
We didn't do Sunday, I can't recall, but Sunday was not available, right?
So this past year, we did do Sundays. We were here. We had a low turnout, but we were here.
Oh, so there was a Sunday option to vote here in Chelsea?
Yeah.
Yes.
Okay.
We try our best to do it. The turnout wasn't great, though. So like Tom said, it would be more overtime into the office. So it would impact our overtime line, not our poll workers line. All that would be the same, meaning that I did hire extra people to handle the extra mail, because typically more people participate. But
What kind of impact did early voting have, not on the weekends, but during the week to your operations when they had to come into City Hall? Granted, we had people escorted into the building, but I'm curious as to know, did that impact your office? And having to do both, serve as a voting site and do work?
yeah, absolutely. It was tough because you have parking, and people just, they'll tell you, customers are complaining because I just want to get my birth certificate. I'm only here for this. Like, why do they get to go to the office? So we do a lot of explaining, just like crowd control. But you are juggling the two, and it doesn't, we have awesome staff here, so you have someone like Carmen staying and then getting to the online or getting to the mail to process those applications or requests. But then we were just constantly, you took someone in, we had to do the distancing, we were cleaning up after. So there was a lot of work, but we got it done.
So if there was early voting, you would say it makes more sense to do it when there's not existing City Hall business being done?
By law, you cannot.
Well, you can't
Yeah.
now, but
Yeah.
if it was, and let's just say it was special, because cities and towns such as Boston have special legislation. And the state has to adopt it, but they can petition. So my question is, if it was to go in that direction, you would suggest for a management position, it's better to have it when you're not already doing other city business than...
No, I don't know that changed. I have to be honest with you, I don't know that it changed the outcome. Had I, for example, if on a Tuesday instead of till 4 or till 4, if I did it till 7 on a Thursday, so added an extra day, I don't know that it would change that much. It's a burden on us, but I don't know that it would change, by changing the hours would make it that much different.
What I'm asking is, for example, instead of saying you also are operating regular hours, and in addition, trying to be a voting site, does it make sense to, instead of if it's a Saturday prior to the election, it's Saturday even before that. So a Saturday and Sunday prior to that election weekend, you allow early voting on a Saturday and Sunday when there's no other business except that, versus trying to have early voting from that Monday to that Friday before that election day, that they're serving not only doing City Hall business, but also, I'm asking if it makes a difference for the overtime to do it during that, then...
I think if you're saying, if you could create such a scheme and make it legal, yeah, I think it's obvious that would be easier, because it was confusing. And it was a bit difficult when we had, at one point, we tried to create two lines, like here's a line for voting, here's a line for everything else. We had some control this year because we were controlling the lines of
Right.
anyone entering, and so we won't be able to exercise that similar level of control in the future. And so it's likely to be even more hectic. So the direct answer to your question, I think, is yes, that would be better, but I don't think the state, for at least state elections, would allow us to do that. Perhaps if you're going to create some home rule petition for municipal elections only, they might, and yes, if you could arrange it so that early voting is when they're otherwise not open, other than paying the overtime, logistically, it would be much simpler, yes.
So it was an option, correct me if I'm wrong, but for the expiration from June 30th, it's an option for a municipality to offer it when they want to. So yes, we can figure that would be done at a Saturday and a Sunday, all as long as it's before that Friday.
And Tom, have you heard anything, given the fact that Boston is facing a big mayoral race and so forth, they get the attention. Little Chelsea will never get the attention, but have you heard anything about that the expiration of early voting and whether or not cities and towns like Boston are pushing for that?
I haven't heard much focus on early voting yet, only because it's not as time sensitive as some of these other things that are about to expire. So, nothing much is happening from June 30th till September when it comes to voting. But other things like, for example, the current law that says you can't operate remotely and have a quorum remotely, that is ending on June 15th unless the legislature does something by June 15th. So those kind of deadlines are getting the most attention right now. That election deadline is likely to get attention as soon as it starts to become a pressing matter. And you're right, Boston's an obvious example. So my guess is there'll be some pressure to create some early voting, but I haven't heard anything yet at the municipal level as to where the legislature's going on that. I think, as Jeanette said, the rules are going to expire on June 30th.
Councilors, any questions?
City, her office is undermanned, in my own personal opinion. And now that you have a Florida, has it worked much better for you?
Yeah, so she's actually learning well. I'll see how this goes. She's learning very quickly. So in the future, I will assess it, but we'll see with the renewal of the parking program and how things go in the future if I come to ask for one more at the window, and so that way we're more efficient at the window, because that is one of the complaints. We do spend a great deal of time with a customer.
Yes. All right, thanks.
Councilor Brown?
Due to the COVID-19 and the pandemic we had, I know a lot of communities were doing a lot of online appointments and, checking in for dog license, birth certificate, all the things you do. Are you caught up with all those requests? Are you still backloaded on those requests? Or?
No, so because of COVID, I think we're getting less foot traffic, but because Tom is allowed that 1 hour on the front end and the 1 hour on the back end, so our altered hours at this time, it allows for the staff to focus on online requests. So I feel like that's where we pick that up. But the foot traffic has been less than it typically is. But we have got, for example, with the online, we've had more online appeals than in person, obviously due to COVID, less people coming in. We've had more applications online for resident permits and stickers. So that's gotten out there.
Okay, so how easy is the digital communication as far as someone wants to pay online to get a birth certificate? Can they then also receive a copy of their birth certificate digitally, like electronically?
We do those, we try to get them 24-hour turnaround, and
So
we've always,
24-hour turnaround? So,
For
but I noticed you
birth,
had a lot of weddings this year, correct?
yeah,
From
we have,
here.
we do the weddings, we do the birth, death. Most people are, they are applying online. But I feel like we've had less sales, and I don't know if because people have other things going on because of COVID. The last year is not a regular year, so
Yeah, so how did you prioritize the request? Because I know a lot of folks that at the beginning, I see it's a lot better now, that they were saying, hey, I made an appointment 3 weeks ago, they haven't responded back to me, and I know was it just dealing with the computer, or what?
no, so I don't know what that specifically to, because we've been open since June 1st. So if somebody calls 311 and says, I want to make an appointment to come in, we've been open to the public. We'll take down the information and we mark them, like we'll say, we let the greeters know that these people are coming at this time, and so that way they don't have to make the line outside. So they were able to just come into the building, they just had to make the line inside. So I didn't know that we had any complaints, because I feel like because we were open, people were coming in, anyone who thought they needed an
You were
appointment.
open by appointment, though?
No.
Their
No,
office has been open since last June 1st of 2020.
Fully open.
The clerk's office has been fully open.
Okay.
As a walk-in, you don't need an appointment.
Yes.
Some people thought we did, but
Yeah.
when we take it as an appointment, so I think we've done a good job communicating with people, saying, well, you don't need one, but if they're planning on coming on their lunch hour, we would just let the greeters know that so-and-so's coming for a birth certificate, so they didn't make the line outside, they had an appointment, so they come in and they skip the line.
All right, thank you.
Council Lopez?
Question regarding, the money you receive for birth certificate, death certificates, and so on, where this money goes to? What account?
That just goes to the general fund, so it's reflected in our revenues and our estimated receipts for the year. All of the money that the city clerks collects for everything is part of our general fund, and it just gets reflected in our estimated receipts.
Okay. Another question is, I know you have more staff in your office. It's only 3 over here for personal. You, Patricia, and Carmen Vega. Where's the salary for all the people that
When we get to the parking side,
oh,
so we're on the
they work
so,
separate? Okay.
yeah, they're.
Also the temporary person.
Oh, the temporary person?
So that's been filled.
That's
The one
been
that
filled.
says to be determined, that money, you funded that position last year. We just never filled it until just recently. So in May, we finally filled this temporary position with one of the persons who previously was operating as a greeter, a Chelsea resident, who was a greeter, has now been hired for that floater position.
Okay. Now, my question was, I know there's 2 or 3 more people there, right? So they work for parking?
They're parking, so,
Like,
yeah.
I know one guy that...
Everybody helps, their title is in
But do
parking.
they work for you, though, at that office?
What was that?
Do they work for you?
Yes,
Under the
yeah.
supervision?
So Carmen and Patty are the city clerk side, and Kimberly Contreras is the new person. She's the city clerk side of things. And then parking is Rosa, who does the traffic and parking commission, and then Hector at the window. They're parking side, but everybody is hands-on, so it doesn't, even though we're labeled as an department, we do everything. So if Hector, even though he's parking, gets someone at the window looking for a birth certificate, he'll sell the birth certificate, he'll get the record. But, so we're 6 people in our office now, we were 5.
Everyone is cross-trained to do all of the work.
But do they work for parking enforcement, or they work for the city clerk?
In the city clerk's office. The parking enforcement is off-site, so Mona, one of my supervisors, they're on Chestnut Street. So they're off-site, and they manage the day-to-day operations. So I'm always in contact with the parking enforcement officers.
Those people are not city employees. They are on a contract with the city. The people who are physically present in Jeanette's office, all of them, whether they're working for the clerk or the parking side, those are all city employees.
Go ahead, I got another question.
Thank you.
Go ahead.
Council Brown?
I just wanted to get something clear. why is a charter book, $3 and a voter card, $4? Why is a voter card more than a charter book? It's definitely not the cost of paper, is it?
What was it, charter book?
Yeah, it says charter book,
Oh,
$3
because-
per item.
So the charter book was created by the law department, I couldn't tell you how many years ago. It's always been in office. It's a very thin book strictly of the charter. Since then, we've told people most people just go online and they just use, because of Muni code. That's
So
always
why
been
is
the
it-
price.
My question, why is it, now, voter card is just one piece of paper, correct?
Correct,
And the charter book is probably 30 sheets of paper.
yeah.
Why is the charter book less than a voter card?
I can look into it. I think the voter card, I don't think we've done those in a long time. Bob used to certify them down the middle. Bob
Well,
Bishop,
it's just to state that a person's a registered voter and you stamp it, correct?
yeah.
Yeah, okay. I just think.
I can look into that to change that, because it makes sense what you're saying, but
Yeah.
it's just been that way, and I don't think we've sold one in.
Hey, I could see why. It's-
Absolutely.
Okay, thank you. Appreciate it if you could let me know what your findings with that.
The parking is on page 112.
112?
I'm sure we're gonna have a
Before
couple
we
of
leave there,
questions
Mr.
on.
President, my last question, did you lose your communication with the license division now? Because okay, so
That was
Law
2016,
department.
yeah.
Okay.
So 2016, they separated licensing,
Yeah.
so now it's at a law department.
Yeah, I remember. Okay, just want to make it clear. Thank you.
No problem.
And so Naomi doesn't really spend a lot of time in your office anymore, right? It's
No.
just totally into legal law.
If
Right.
anything, she works with more closely with ISD.
And now, when businesses need any sort of permitting for that sort of operation from licensing,
So,
they go straight up to law department now?
so I still get the calls, and I'll forward them to Naomi, because they're so used to it being Debbie, so when they call, they'll leave messages for Debbie. But they're getting used to it, but it's all through Naomi. One of my goals on the city clerk side was to, I want to do a better job of, you want to apply for a business certificate. So what happens is someone comes to my office, they apply, and they don't know that they need an occupancy permit. So I tell them to go get an occupancy permit, but when they return for the business certificate, they don't really know what to do from there. And so I want to work with Naomi from licensing and ISD and get to, maybe it's a flyer that says, if you're doing these businesses, should go to licensing, because I think they genuinely don't know what the next step is, right? They did the right thing by getting the occupancy, getting the business certificate, so for example, you don't need to go to licensing for a salon, which I didn't know that till recently, but if you put a TV in the salon, you need an entertainment license. So I want to do a better job of giving that to the customer. So that's one of the goals. So they don't work with me, but because we're all kind of connected just with that one thing, I want to work on that.
Okay. So we're moving on to page 112, and we're talking about parking. So would you like to explain the budget for the parking, and then any changes and goals?
So no changes to the salaries or the expenses. If anything, I slightly made some cutbacks in advertising and equipment maintenance, and that was just because looking at fiscal year 20, I saw that I can just, a little wiggle room there, and, just, I guess, giving back a little bit. But outside of that, I didn't request any changes. And there are no changes to the personnel in that department. So it's the same people.
Okay. Councilor Recupero?
Did we buy any new cars for the parking enforcement?
So we bought the Transit, and then we just, in the CIP, I have for a new transit vehicle. So what that will do is that will complete my fleet. So we have a 1999 Astrovan and a 2001 Taurus. So we'll have the 2 Ford Focuses and 2 Ford Transits. So that will have, those will all be newer cars.
So the 28,500 you see at the bottom of the page, for vehicles is what she just described.
What would there be at this thing here? What part of it shows how much we pay for them?
It's on page 114 on her capital plan. You've already approved that 28.5 in the CIP.
So it doesn't actually tell us how much we pay for these cars, right?
We think the price is 28.5.
Yeah, we get a quote for them, more or less, and that's with the paint and everything, the graphics.
28,000 new one, so we pay 28,000 for one. That's all we got was one?
Yes.
Another question too. I'm sorry, Todd. Resident commercial stickers, right? We sold 25 of them. So we selling commercial stickers to big trucks to park outside in our area?
For the resident,
Yeah, it says resident commercial sticker for 6 months. You sold 25 at 7,500.
Yeah.
So these are people that live here that have commercial trucks that they park in our streets?
yeah, so in February of 2020, we approved, first came to I was asked by the council to go over the program and see where we can make adjustments. And one of the ones we came up with doing research with local communities was a resident commercial, because we didn't want to punish the person trying to make a living, right? So the car is a commercial vehicle. It's registered out of Chelsea, garaged out of Chelsea, but they pay $300 every 6 months because it is a business vehicle. They're allowed one per household, where before, the problem lied in the general non-resident sticker. So everyone was buying that sticker, and they didn't have to register the car here. They were just paying the $300.
We eliminated that.
We eliminated that sticker, and to cut down on those types of vehicles. They're typically bigger vehicles. Not necessarily, not always, but they typically are bigger vehicles, and they're not paying excise tax here, so we don't allow for it anymore.
So I mean, I know I understand what a commercial vehicle is, but a commercial vehicle could be any size, right? Though we have a restriction on the size that we can use?
Yes, we do have one. We kept that. So we have no more than 6 tires and 9 feet tall, and we still abide by that. So when someone comes in, so we recently had someone with a camper. They came to us. We saw that the plate type was strange. It was a bigger car. So usually someone from the traffic unit, we will get in contact with them, and they make an appointment with the person who's trying to apply. They inspect the car, and they let us know whether or not they can apply, if they're approved to apply, and then we would allow for it.
Okay, thank you.
Council Taylor?
Can you explain what other services include?
So other services is the staffing costs. I know that it's called other services.
Sorry.
The staffing costs. So for the parking enforcement officers, and then anything, so any R&B fees that are assessed to us for having access to the R&B. Sometimes if a printer breaks, a handheld, the unit would come out of that line.
Okay, so that's just,
So those are personnel. We have a contract with a company for the parking control officers. In that price is their cost of that contract, which is pretty significant on an annual.
so that's why I'm asking. It's a $508,000, so,
But we generate much more than that on revenue that they.
but I guess, I just didn't understand what that was. So that's basically for a vendor contract.
Correct.
Yeah, parking enforcement
Okay.
under contract, yep.
Thank you.
Council Brown?
I just personally wanted to say, our office, and I said to you before, there was a lot of chaos going on in the 2020 election, but Chelsea was one of those communities that really stuck out and got a lot of praise for your work and your effort. So we really thank you for the work and all the collaboration that we had with the office. But Chelsea was one of the offices that really stuck out at our office during the 2020 election. So I just wanted to say that.
Thank you.
Good job. Extraordinary.
Can you explain a little bit about this, the plate reader? I know that this was something that the police department had in the past, but it reads as if it's now in the use and hands of parking enforcement. So is that what's actually happening, that no longer it's just the police personnel that is driving this, but it's actually parking enforcement? And can you
No.
expand on that?
Two different uses. So ours is strictly, so it doesn't run registrations like the police does. It's strictly for parking enforcement, meaning that, so we use it for two things. We use it for the residential parking program, whether or not you're, so in the terms of the equipment, it's authorized to be here. Do you have a sticker? All it does is a piece of equipment that sounds off to us that says, beep, 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 this car doesn't have a sticker. We come out of the vehicle, we check if you have a valid permit, you have a valid permit. If paper permit, like a visitor. If you have a sticker, it will acknowledge you have a sticker. And then we do the metered parking limits. So to drive down Broadway and to see if you're over the 2-hour limits. But it's not a perfect system. It helps us. It's, again, in the terms that they use is authorized, not authorized. So, for example, those 15-minute spaces I think you requested to, for example, those, because it's among two, it's really on us to enforce the 15 among the 2-hour limits. But that the system is strictly that no data is stored and no data is collected in that way. Totally two different systems.
Okay. Would you happen to know, if we didn't look at the revenue, but would you happen to know what changes as far as revenue goes now that we're going more and more with coinless, we're using more and more apps? Has there been a dramatic, I predicted would have been a dramatic increase, because as in the meter, you put a quarter in, you leave, that time is still there for the next vehicle. So I'm imagining this turnaround has probably increased the revenue, parking revenue. So is that the case? And go expand a little bit about that.
Well, we have two different revenue streams on that. The first would be the parking meters, and the second would be the parking enforcement, the tickets. So the parking meters, that's in a separate fund, and
what page is that on in the revenue? Do you have that?
I think it's not part of the general fund, so you're not going to see it in the revenue stream. You see it as an expense out in the indirect cost when we ask for the money to be transferred back. So it's on Tom's forecast as a transfer in as an indirect cost, similar to what the school department gives us for grants. So you'll see that from our parking tickets, it's a $300,000 transfer that we do. So on the revenue side of that special fund, we have about $235,000 collected so far in '21. In '20, we had $296,000, and in '19, $360,000. So it's dropped in '20 because of the COVID impact. My expectation is that. I think we have also, in the same line, the meter app that you referred to. So there's I think it's Passport, that has this application where the payments can be made
I use it
electronically. And so we're seeing transfers in to this line from that app. So I don't know if that comes through Jeanette's office or the treasurer's office. I'm not certain of how that functions, but we are getting the revenue stream through the parking meter line.
Right, so I'm just curious of what the parking meter app income level is at this point, and it's been in about 2-3 years now in Point Place?
No, so, well, it was implemented in late summer of 2019, and then COVID hit, it was March, so, and then we didn't return until June 1st, and I don't think we started ticketing right away,
Till
so.
August, I think.
I feel like it's not a true, again, I hate to keep using that, but until, we get past this,
I wouldn't be certain if the numbers I'll give you, it's around 4,200 a month, and that's what I'm quoting is from recent months. So this is the February of '21, March of '21, January of '21. Those are all, in average, 4,200 a month. Now, I haven't gone back to compare previous months to see if there was a higher stream than that. We didn't finish the analysis on that for today, but we do have this information, and we'll have it readily available for another meeting time if you'd like.
Are we seeing the eventual elimination of those parking meters, specifically with downtown Broadway, the planned rework of the sidewalks and what is coming down the next year or two? Is that sort of street furniture being removed and using, obviously not everyone's going to be able to use an app, but are we looking at what we see in other communities, the parking station
Yeah, I
stalls
would-
instead of the turnstiles themselves?
We have not got to that level of detail in the design, but I can't imagine when we redo Broadway, we're gonna return to those meters every space. We'll probably put the more attractive and less obtrusive stations up, like they just did on Revere Beach, and like we're doing in the parking lot. We will have them in the...
Under the Tobin?
In the new lots, yeah. So I would expect that when we refurbish Broadway in a few years, we'll go to the station.
And I absolutely have my eye on that. That won't slip by me, because I think that when that happens, the other has to happen. Because the meters going into the ground, if someone hits them, DPW has to assist, we have to cut them. I would like to see, once those changes are made downtown Broadway, that we upgrade the meters as well.
Okay.
So the second revenue stream that I referred to is the parking tickets. So like you just talked about the parking meters, there's also the parking tickets, and that's on track for about $2 million in revenue for fiscal '21. We had thought we'd see a drop. We had budgeted $1 million instead of $2 million from the previous year, but we are seeing, it seems to be on track with what it was last year as well.
What is the third-party contract? Because that is not actually a line item.
I don't know the exact cost, but it's split over 2 lines. The Councilor Taylor had mentioned it once in the other services line at 508, but there's also a component of that in the data processing line at 289. So do you know the exact cost of that?
So the
Is it around
last
three?
contract was, so the one expired is closer to 800,000, and then the new one should be 829 because of staffing and data processing. So
And there's
we're
a
in the middle of
postage
that right
component
now.
to that as well.
Okay.
So if you look at those two, the 508, the 289, and maybe 100 or so in postage, compared to the revenue stream that I just quoted on the, so we do see it as a valued contract and a
The net
valued
benefit,
expense.
for sure.
The number that you quoted, that doesn't include anything issued by traffic, motor vehicle violations by the police
No,
department, correct?
that's coming through, the police department or the treasury. That's a separate line.
Okay. Any questions? I kind of hogged up all the time on that one. Councilor Lopez.
The place, right? We collect 6,700. Do we rent that place, or how are we collecting money?
So as long as I've been here, we've always sold at the meters. So one portion is private, and it's marked that way, but it used to be available to us. We sell every 3 months a permit for $150 for anyone, a business owner or employees on Broadway. It's kind of I think the idea was an incentive to take them off Broadway and create that turnover on Broadway by putting them into Luther Place. And what happens is a first come, first serve. And so you buy the permit, and if you're there first thing in the morning, whatever spaces are available, you get to park there without feeding the meter. It's the only place we do that. And I think
The bank, I think it's a law firm, I think. Do they rent those spaces?
I don't know. I think
That's
I don't
private.
know. We used to use it, but they took
That's
it back.
Councilor Recupero.
Here, gasoline, you got 5,600 proposed for 2022, right? That's for the parking, the people that drive the cars, right? Now, is that kind of like gasoline's going up? So you're proposing something from the old?
I kept it the same, yeah.
I mean, they use that much gasoline? They drive
We
around
run
all
the day
day?
and the nighttime program, but yeah. Because we use the same vehicles during the day and at night for the overnight enforcement.
Okay. It's kind of,
We're running behind schedule here, so let me there's no more pertinent questions, I would like to thank Jeanette for coming and
Thank you.
move on to our next staff member.
Thank you.
So I believe next up is
Ned
Health
Keefe.
and Human Services. Am I
Services, Health and Human
So
Services?
We have a number of divisions there, and I'd recommend we go one at a time with each of the department heads for each individual division.
That's
We
fine.
can answer questions.
So just for the council's understanding, when Luis Prado retired, we did not fill the position of Health and Human Services Director. We hired instead a Public Health Director. There is
First
still
page,
this small
145.
piece, and that's Flora Maya, whom I'm sure most, if not all of you have met. Before we get to her specific department, though, there is this sort of leftover administrative piece that now, that really is just the administrative assistance. And this is a piece that these individuals now really report for the time being to Ned Keefe. And that's Julie, and then there's the vacant position. So we...
Jack of all trades.
So Ned is sort of overseeing this piece of Health and Human Services, these two staff people, and so before we get to floor, if you want to just look at the salary and expense line item that's on page 146, this is where you're going to find Julie's salary and the salary of the vacant salary that was previously occupied by Margarita, who retired post the submission of the budget and whose position has not yet been filled, although we will fill it. In addition, we have this one grant-funded position, which is Ryan Barry. This is a DPH grant that we just got renewed for 2 more years. This pays fully for Ryan's salary and his benefits, and he's grant-funded fully by that grant. It's a Department of Public Health grant. So the salaries are, as I said, for those 2 administrators, and I'll actually have to turn to Ned to the equipment rental reference in this item. The copier, okay. The cost of the... And that's the entire sort of salary of this administrative piece that's kind of an orphan now, that we don't have a director, but these 2 individuals report now directly to
Yes, and we've moved the expense, the bulk of the expense budget out into the next department, the 511 Health Officer, so we see a $380,000 drop. On contract services, you'll see a $380,000 increase in the Health Officer budget 511. Same is true of the conference and travel and the dues and subscriptions lines that are also being zeroed out.
So
I apologize, what has been removed?
The contract services,
Right, I noticed it's a drop.
So those are the contracts that we have for most of our social service work, the navigators contract, the housing support contract, the CAPEX social services contract, the payment for the North Suffolk Public Health Collaborative. Those were previously under the purview of Luis. They've now been shifted and now are under the purview of Flor. And so we just moved that 380 out of this, and it's now in the public health line item.
Well, it's not 380, so I should see 160 somewhere else, and not 380, but it's 380 now. Last year, it was 540. The adopted budget was 380 in the proposal, so we should see, the adopted budget of last year in FY '21 was 380, actual expenditure was 540, correct?
The actual expenditure, that was the actual expenditure in FY '20. I think in FY '21, we spent the 380. I would have to go back and try to see why we spent 540 out of that line item in fiscal year '20. I don't recall, but it was probably some one-off thing that we did within this
So we'll
line.
see the proposed 380 and another,
It's 381. If you look on page 150, you're going to see it there. So some of your questions, I think, can be answered when we get into the detailed description in 511.
okay.
I guess just before we go to 4, are there any questions on this sort of administrative piece that encompasses Julie and soon-to-be successor to Margarita?
Soon-to-be successor,
Her, whoever, we're going to hire someone to fill that position. We haven't yet.
you haven't yet, got it.
Yeah.
Go ahead.
So she's going to fill the position of Louise Clark? No.
No.
Okay, that's,
She is we're not filling Luisa's position.
okay. So I want to hear about her responsibility and her mission and,
Yeah, that's in the 511 budget, which is
Okay.
the health officer.
Floor is the public health director.
well, that's why I'm kind of confused here a little bit. That's why I'm just trying to figure out where she
The
sits.
510 budget has some drops. There's 114,000 in salary that's been reduced because Luis Prado's position isn't filled
Right.
in this budget. But you're going to see in the 511 budget, there's a health officer position.
Okay.
So
And
Luis previously oversaw all these
Right.
various divisions. We
Understand.
eliminated that position.
Understand.
Now, these are independent department heads,
Correct.
all of whom report to Ned and I. There is
Ned and
no more
yourself.
intervening
I
person.
understand that.
Floor was hired exclusively to run a new public health department. We never had a public health director.
Okay, so that's why I said what I said. I wanted to hear her goals and what she's going to be doing.
So we can move now, if there's no questions on that
Can we hear,
administrative piece.
if she's going, because I'm new to her.
Yeah,
I
she's
see
in a
her
di-
around.
she's
I'm
in a
just
different
about to
department.
move to that.
Okay, okay.
moving
so
in
we-
that
Okay.
direction.
All right, okay. I'm a little impatient because I kind of got confused with these numbers and where she was sitting at. It seemed like a lot was shifted to Ned, and then my thoughts was who she's going to respond to, so.
I did, I'm so sorry. I just came up really soon
I
and
know,
sat
I know,
here.
I've seen,
So-
I know about it.
If you're ready to switch to the public health department.
Let's
We
do
are
it.
now going to switch to the new,
Yeah.
go ahead, Councilor Robinson.
Are we supposed to have a director of Health and Human Services?
We are not required by law to
We're not
have.
required by law?
No.
Okay. Thank, that was my question.
Councilor Recupero.
You are, in other words, Mr. Louis Prado.
No.
No, I understand. You don't have the same responsibility as he does because they split up his department in many different sections.
No, we didn't split it up. We stopped funding his position, and we funded a public health position in the
But
511
Mr.
budget.
Lewis, you
I'm
should
gonna
take
cut
care.
I'm gonna cut you off because we're not there yet.
Oh, we're not
Okay,
there.
we're not there yet.
All right, when we get there, I can ask. All
When we
right,
get there,
fine.
we can ask. Before I lose complete control. Is there any questions regarding the transition from the new structure previously with Director Louis Prado? Any questions on that? None. We're moving on. Now,
Right, so
we are now,
this is the public health department.
this is the Public Health
We
Department. and
hired
have
a new public health director.
Yeah.
She oversees right now herself and the public health nurse. That is the sum and substance at the moment of our public health department. Hopefully it will grow, but for now, it is Floor and our public health nurse, Paula McCann. With that said, I'm going to turn it over to our new public health director, Flora Maya, to talk about the new public health department of the city.
Hi, good evening, everyone. I apologize for the confusion based on just coming up front really soon. So as Tom just introduced me, my name is Flora Maya, and I am the director of the new position of public health. And The goal of the department is drawing a lot from what Health and Human Services or elements of the former Health and Human Services division or department, in the fact that the aim is to promote the health and the wellness of Chelsea residents. And the models that we will use is the collaborative work, not just between here, City Hall, and the different departments, but our community in general. Public health is a really broad field that encompasses not just an individual's health, but also where they live, their environment, access to the essentials. And so it is a really broad goal that can only be achieved in collaboration with our community. And this is in an effort to mitigate essentially the social determinants of health, and we will do this by engaging in needs assessment, continuing the monitoring of infectious disease and the surveillance, and also thinking beyond COVID, thinking of the chronic health conditions that plague underserved communities and also the BIPOC population, like the one we have here in Chelsea. And that is just, in a really short brief, what we will focus on from here on. There was a lot said about the budget, so I'll wait and see if you have any questions regarding some of the key elements of the department itself, or...
In your role as the Director of Public Health, are you the assigned city person for the Board of Health meetings?
Yes, I am an agent of the Board of Health. I am the one attending the meetings.
Okay. I'll allow my questions. Any other questions for my Councilor Robinson?
Are you going to be responsible for overseeing the Navigators program? Did I hear that correctly?
Yes, and so as Tom mentioned earlier, some of the contracts that were previously under the Health and Human Services Department are now under my supervision, and those include the Navigators program, the Housing Basic Services Support, the Social Services Referral and Case Management, and also the North Suffolk Public Health Collaborative.
And you'll be sharing those reports with the city council when you meet with them, and what type of results that they're providing in regards to their contract?
Sorry, can you repeat the question? I wasn't able to hear fully.
That you will share with us the information
Yes.
in regards to their contracts as to whether they're meeting their goals.
Absolutely.
That they,
Yes.
all right, thank you.
Councilor Brown.
Yeah, I just want to officially welcome you, look forward to working with you, be at your assistance, anything I can do to help you. From your brief introduction and also your desires of what you would like to do in the collaboration with the community and the city itself and the department. It sounds wonderful, and I just wish you all the best. And again, as Councilor Robinson said, the city council is here to support you and help you, and hopefully, you can get right to work.
Thank you. I appreciate that, and I will definitely be following up because there are a couple of things that have come up already that I could get your help on.
Thank you.
I do want to just mention that this piece that made mention of the North Suffolk Public Health Collaborative, we've been in that for a few years, and I know it's been sort of a bit of a slog for the first few years, but we transitioned from a director to having MAPC oversee that collaborative, and it's really become a much more robust effort over the course of the last year. Through COVID, that collaborative generated at least $250,000 of additional COVID funding because it was a collaborative that otherwise would not have been available to the city. We just got a grant that isn't final yet for a shared epidemiologist for the 3 communities. So we'll be looking to do some hiring probably over the summer for that. And so and Floor is our representative on that group, and it's become a pretty helpful group, especially during COVID. So it was this sleepy little thing that I wasn't sure was worth the money before, but now that it's our administrator's MAPC, it has definitely paid dividends through COVID and generated more in 1 year in additional dollars to us than we've paid to it in the last 4. So it's been a net benefit to us, for sure.
Any other questions for our new Director of Public Health? I know she's been busy, so.
Yeah, and just,
Okay, I think that's it.
So next is
That's
Elder
it.
Services. You're all set. Thank you.
okay, great. Thank
Is,
you.
Tracy.
I was going to highlight some of the COVID vaccination rates, but I'm sure
Oh,
you have
I
the.
don't-
Yeah, absolutely.
No.
We'd love to hear we're bragging about them,
No,
actually, so.
So just to give you just a really brief glimpse of what 21, I know that the early phase of 21, you all know that better than I do, but at least in the last 3 months, we've been, as Roy mentioned, busy with the vaccination. And I started February 4th, and on March 17th is when the first equity report came out on the vaccination rates for the city. And on that day, as of March 17th, we had only vaccinated 4,038 residents, and this is fully vaccinated, which means 2 weeks after your second dose of, at that point, Pfizer or Moderna. And as of May 17th, we had vaccinated 15,339, and I know that that is not nowhere where we want to be. We still have a lot of work to do, and this is where the collaborative effort comes in, and all of us push in that same message to our community, to everyone within our network. And so that is second doses fully vaccinated. Keep in mind that first doses, that number is a lot higher. It is 20,879. And the reason why the second doses typically move slower is because of either the 3-week or the 4-week that you have to wait for the return rate. So we're moving in the right direction. We're not very behind the rates of the state, but we still have a lot more work to do, and I'm really hopeful that the same way that we overcame the first phase of COVID, which was the testing, the decreasing the rates and lowering our positivity rate, we can increase our vaccination rates.
Since you brought this matter up, and again, it's our fault, I'll take my own personal responsibility for not highlighting the work that you've done, or touching upon it and discuss it. Typically, budget hearings are more about facts, numbers, and not the actual job, but you did come into a new role here, and I know that you're collaborating, as you stated, about getting the vaccinations out and with the testing. When testing first started last year, and I had a conversation with the city manager, we were, and I was one of them, who put a lot of pressure on him, MGH and so forth, to say that we're not testing enough, we're not testing enough, we're not getting enough testing. And then quickly, a lot sooner than someone would expect, before you knew it, we had several areas that you could get testing. Where it was prevalent, you could walk at 2 different sites. You go to MGH, you could go Beth Israel, so we had to get out of it. It was just tough to get out of the gate, but once we hit the first quarter, we were rolling. And I know that when we were discussing vaccinations, and I was having a conversation with Tom, and that we were talking about vaccination rate, I said, yeah, I think it's going to happen the same way when we were talking about testing, which was we were under pressure to get as many sites available. We were criticizing our own stakeholders for not available, for them limiting. If for some people would recall, there was a lot of limits to whether or not you can get tested. You had to show signs before you even got tested, and we were like, why are you doing this? And we were hit with the pandemic, and sure enough, all that was done. And the same thing, with the vaccines. It was limited to certain groups. And now we're at a point where we are offering pupusas to anyone who can, get a vaccine. So we're at the lowest age possible. We're into the youth. The question I have is, besides knowing that your role in collaborating all that, what role do you have in, say, oversight when it's an independent party, whether it's Beth Israel or MGH offering their own, and not actually within our own offering? Do they have to come in front of the city in order to offer those sort of services? CVS, nothing, they can just offer this, even though it's, a service, a health service, and do they have any sort of oversight, overview, whatever, input from the city, your department in particular, when that happens?
I would say this, and Flor can add her perspective. In most cases, we've played a supporting role for these independent entities, sometimes more supportive than others. So, especially early on, like March, April, we were at times ordering the vaccine because as a city, as an equity community, we had access to vaccine that some of the health providers did not, even providers like MGH. So we would coordinate with them to do a clinic. We would order the vaccine, we would kind of flex it to them, and we would work with them. So we did that with some of our Chelsea Housing Authority facilities. As time went on, vaccines became more available, and we were able to sort of step back from our role as kind of facilitator and just work with them to identify, here's where we would like you, go order your vaccine. We still have the capability of ordering our own vaccine, but at this point, we have more vaccine than we have arms to put them in. So we've sort of, for the last few weeks, declined to order only because we have plenty of vaccine. And now our role is more overseeing, making sure there's no issues, and that's kind of the role that we as a city and Flor is now playing, more of an overseer. But there's no permissions that have to be granted by the local Board of Health. Most of these healthcare providers are operating on their own with their own set of regulations governed by the state.
I would like to give you the opportunity. I know there are those that are separate, Beth Israel and East Boston Clinic and so forth, but the city itself has had its own vaccination program, and you've been working with some stakeholders. Do you want to touch upon that and who's been working? I know that Lourdes and the Facebook. But would you like to just touch upon what's been going on? I know you're doing weekly, but who are the stakeholders that you are working with and volunteering with them?
So there have been, as Tom mentioned, multiple efforts in providing the vaccinations here in Chelsea. So with our ability to have and order equity doses, we have hosted our own clinics. The Educators Clinic was one of them that was done in collaboration with the Department of Public Health and the school department. And it has been myself, the nurse, managing the vaccine, ordering the vaccine, and setting up the infrastructure to then record and do the inventory. So after every clinic, you have to send to the state who has been vaccinated, who hasn't, and this is how they're able to monitor and keep track of the vaccination rates. And so Lourdes helps us a lot with the communication and just showcasing what we do, and that has been really, really helpful. So in addition to the Vaccinators Clinic, we have also the city collaborated, or my department, the Department of Public Health, with MGB, also with Chelsea Housing Authority, and with the Senior Center to host vaccination clinics at those locations. So us spearheading the organization component, who the vaccinator will be, because as Tom mentioned, the department is only Paula and myself. Paula is not able to vaccinate 500 people all alone. So we have to rely on other providers, vaccinating providers, whether that is Cataldo, Brewster. Sometimes we've relied on our school nurses, not just from Chelsea, but other municipalities, especially for the Educators Clinic. And so there has been, I think, immense response and everyone pitching in and really wanting to not help, but really make a difference in this effort.
Have you been working with any particular nonprofit that?
Oh, yes. So for the outreach, we are working with Chelsea Black Community, we're working with Green Roots, we're working with La Colaborativa, and everyone is helping us on the ground to do the outreach component and doing the door knocking. So it's a big endeavor that Paula and myself would not be able to do by ourselves, like independently.
We've been blessed in this community that these nonprofits, La Colaborativa and Green Roots, for instance, have been granted independent contracts by the state's contractor, ASG, to do outreach, so they have their own contracts with them for outreach. Chelsea Black Community was hired independently by Cataldo on the senior center effort to do the coordination work for that. So we, having these local nonprofits that are engaged in the community be under contract to do this work and being paid by other entities has been very helpful to us.
This is the only way that we've been able to build capacity from this department.
Okay, great. Any other questions?
I just wanted to say thank you again. I knew a lot of the stuff that you were trying to get, but as she just spoke about, there is a lot of collaboration, and I know you have been working very hard because Tom keeps us updated with all the information and all the sites and access, if we can even pass it out to our network. So I want to just thank you on your early tenure here, and hopefully it's a long tenure. Thank you.
Hoping for the same. Thank you
Thank you.
all.
Okay.
Thank you.
Next on the agenda, we have Elder Affairs.
So that Tracy Nowicki?
Hello.
Hi, Tracy.
Hello, hi Ed, how are you?
Good, thank you. You prepared?
This is page 152.
152, please. Elder Affairs.
Good evening, everybody.
Good evening, Tracy.
Most
Nice
of you
to
know,
see you.
Nice to see all of you. It's, this is actually a nice opportunity for me to be before you, so thank you for inviting me and having me. And I'll just go over the Director of Elder Services. The Senior Center and Elder Services provides health and wellness programs to anybody in the community 55 years of age and older. Some programs, that's right, you can join whenever you want.
Bingo.
So the goal is, and the mission statement of the Senior Center is just to provide these services to maintain the health and well-being and to assist those in the community to live longer and independently. Doing that with collaborating with local agencies and even city departments such as Floor and the Public Health, and being able to provide those services.
That's it? That was fast.
That's it.
Tell us about all the big changes coming up.
So we are open as of May 10th, kind of post-COVID, and we are doing that safely. There are some restrictions with regard to capacity, and as we move along, we'll go with the changes with whatever Mr. Ambrosino imposes, but through the state. But right now, we are limited capacity, limited programs. Seniors do have to call in to reserve still a spot to participate in the exercise and the bingo, and we do have quilting. Masks are still worn. Sanitizing is still enforced. They're very open and free to show us their vaccine card. I will say that, I want to say, we were trying to figure out today, I want to say it's up near 90% of our membership, might be a little bit more, are fully vaccinated. So that's really good. I also wanted to thank you for your support on the funding for the transportation, which we are looking to get moving now. I am working with the procurement department to get out a request for proposals to get a contract for that.
Is there, I noticed that it's only $20,000. Is that not including in the service contract that potentially?
Yes, that's you appropriated money through free cash, that's in a separate account.
Okay, so it's not going to be part, so if we do transportation officers, it's going to be once again, a free cash,
Yes, you appropriated
Appropriation.
$75,000 for this coming year.
and I know that you're looking at some, hopefully some major renovations at the senior center. When that might come into play, is that part of the CIP this year, or upgrades? No?
So the upgrades have been made and continue to be made with the help of, thankfully, Fidel, the DPW commissioner, and his staff have made really big improvements now. And we're looking to put in a sound system throughout the center so that there's speakers and cameras as well, which we've never had. So it'd be good to have cameras in certain points of the center, a surround system also throughout the center, just so that it's easier for us to either locate people, remind people when the next class is, maybe even just do some other nice things with that surround system. Also looking to upgrade the computers. There is a shift with the population that the younger senior age is tech savvy, so that's a big request.
Okay. Counselors, fellow seniors?
I just wanted to say thank you for all the work for council officers. Are the seniors engaging now? Are they coming out? I know they're not still there, but one time I thought they were like mingling. Are they now coming together?
They are enthusiastically at the center, and we actually have waiting lists. Just because, again, we limit the capacity. We're starting to lift that a little bit, but we have waiting lists, and people are just enthused. It was tough during COVID. We had a lot of loss in 1 year, just members at the center. We lost 15 people since last year, and that's been tough. So we're looking to do something with the members there in terms of a bereavement support, and have maybe the local clergy come in just to kind of offer a little bit more support. Yeah, we've been, that was our biggest challenge coming back with the seniors, was just a lot of sadness with the families that were affected. So we've been dealing with that. It's been more social work than anything else, but the staff has been extremely needed and wonderful. But on the positive, they're thrilled to be back, and they're getting back in shape. You're welcome.
Councilor Lopez.
I read over here that you said during the COVID, you provided grocery bags of food to over 400 seniors for a week. You were spending from your budget, or where were you getting this food from?
I can't hear you, I'm sorry.
You were providing 400 bags of food for seniors.
You were providing 400 bags of food to seniors?
So during COVID?
During the week.
During COVID?
Yes,
So-
where were you getting the food from? How
Okay,
were
so
you
we
paying?
partner, so we partner with the Greater Boston Food Bank, and they support the grocery bags to us. Right now, it's every month. That's our regular program. So it's about 350 bags that we put together through volunteers. Greater Boston Food Bank drops it off at the center. I have volunteers to put all the bags together, and they distribute out. During COVID, it was, I think, 300 a day. We went from a social recreational center to a emergency food distribution.
This has, what I'm gonna say now has nothing to do with the budget, but I was a volunteer when they started doing the vaccination there, and I saw about 3 people that needed a wheelchair. There was no wheelchair at the entrance. Do you have any around? to
Any
provide
what?
for someone
Chairs.
who needs a wheelchair.
Wheelchairs,
Oh, yeah,
yeah.
we have wheelchairs in our basement.
That day, we were looking for one, we couldn't find one. There was a guy with crutches, he couldn't walk, really. And we couldn't-
That might have just been that they didn't
Just
know where
found
they
that
were.
out. I was there as a,
Yeah, that might have
Oh.
just been that they didn't know where they were. We have wheelchairs, walkers, canes, crutches, other contraptions for,
thank you, I was just throwing
Yep.
that out.
Council Robinson.
You want to share your event on Friday, that you're going to be losing Carlos Rosado to retirement?
yeah, so we're having a coffee hour, it's actually an hour and a half, but for current employee until Friday, Carlos Rosado. He's there when I started the senior center for 14 years. So fortunately for him, he gets to retire now. Unfortunately for us, we lose a good worker. So we are looking to replace him, as well as, I wanted to mention, because during COVID, Marianne Ramos, who was with the senior center for longer than, I want to say maybe 20 years, she had retired during COVID, and I wanted to, actually, this is a good opportunity for me to just thank her and congratulate her. She's a wealth of information and just a really strong person and advocate for the seniors. She's still involved, thankfully, on a different level, but we're also looking to replace and hire for her position as well.
Okay, thank you, Tracy.
Thank you. Good to see all of you. Thank you.
Veteran Services is next up, and
Francisco.
Francisco Toro will be joining us in just a second.
Good evening, everyone.
Good evening, Francisco.
Page 156.
I'm sorry, which page was that?
156, 156.
156, next page. Veterans page, Veterans, Department number 543. Go right ahead, introduce yourself.
Hi, everyone.
Reintroduce yourself and tell everybody what's going on.
Francisco Toro, I'm the Director of Veteran Services for the city. And we're basically the frontline agency that provides the support, whether it's medical, financial, or quality of life issues for our veterans in the community. That's basically what we provide, and that can be split up in just so many areas. On the medical side, one of our major concerns, especially during COVID, we did get a lot of calls for behavioral health issues. There was a lot of food assurance issues at the beginning, but luckily we've had a long time relationship with the Greater Boston Food Bank as well, and we've been supporting veterans in the community for, I believe, about 12 years that event's been going. And we continue to provide dental, rent, fuel assistance, whether we're reimbursing for co-pays. Obviously, burials were an issue as well. We have our monthly events, we have our annual events, we have the upcoming Memorial Day event, the in-person, Monday, May 31st, 10 a.m., and it's going to be approximately 2 days after the change. So that's going to be something that we're looking forward to recognizing the many veterans that we lost over the year. It was very difficult. So, do you have any questions?
Yeah, I'd just say, unfortunately, we would have planned a larger Memorial Day effort, but during the time we were planning, there were strict capacity limits in place, and so they got lifted sort of at the last minute, and it didn't allow us to plan anything. We expect next year we'll get back to our normal Memorial Day exercises. This year will be a smaller event, but it will be outside in front of City Hall. It is open to the public, and we certainly encourage folks to attend, and they're going to kick off at 10 a.m., correct?
Correct. And I think,
Francisco, I have a question. The FY20 actual expenditure for veterans benefits were $228,000. FY21, we adopted 320, but we don't have what was actually spent yet, actual expenditure for FY21. Are we on par with that 228, or is there a need to ask for the same amount of 320?
take a quick look.
I can say that we're lower than expected. We have, at this point, 162,000 expended, and that's without the May and without the June. So there's 2 more months anticipated there. So we're coming in lower than that 320.
Right, so you're saying we're at 160 right now, the pace?
Yeah.
And that would make it even lower than 228 of $228,000 of FY20.
So I think, we looked at that, and there was some thought about, should we lower this number? I guess our concern is that both in 20 and in 21, we were dealing with COVID. We don't really know what the normal is. This will be the first full year out of COVID since 19. I think, this is one place where I don't want to run out of money in veterans benefits. So I'd like to carry this number for 1 more year. If we see that in May of next year, we're still running at these current levels and that this wasn't a COVID impact, this was just we're not having as many demands from veterans, I would recommend that we'd lower it next year, but I'm a little wary of doing that this year, just because the last 2 years have been impacted. Last 2 fiscal years have been impacted by COVID.
Okay. I can understand if I look at, for example, just a 5-year trail. So you're basically, you're indicating here that possibly 2018 and 2019, the expenditures were around 320, and that's why you're keeping it?
Yeah, because when I first arrived, we were at the $500,000 mark. We were reducing it each year based on what we were seeing. And we got down to 320. We thought that was the right number. And then we saw this drop off in 20. We see this drop off this year. It may be that that's the number.
We knew there were reductions in this number. As you point out, in 20 with the actual at 228, we were aware of that, but we were still uncertain of what was coming for expenditures, and we then supported keeping it a little bit higher until we could measure that.
Could that be just as a result of, say, a gap in the wars and number of veterans between, and it's a trend, or?
I think Francisco's, and he can speak for himself, his belief prior to COVID was we were losing lots of veterans because the city was becoming unaffordable to them, believe it or not.
Yeah. No longer Chelsea residents, yeah.
Yeah, and during COVID, losing 53 clients was, had an impact on the bottom line. Other than that, you have to keep in mind that, they are submitting proposals for low income and affordable housing for veterans. And that's going to add about 300 new veteran residents who are going to qualify in most cases for our program. So even if it does go down, it'll be temporary.
And there's a couple of other lines there that you'll want to take a look at as well. Besides the Veterans Benefits line, there's the Medical Services line and the Veteran Support Services. Those 2 other smaller lines do support veterans in different ways as well. The medical with the medical expense and dental expense, you'll notice the same thing there. The trend is downward. We have 37,000 in fiscal 20 against the two years, 21 and 22, proposed at 95. Looking at expenses for 21, we're in the $25,000 to $35,000 range. So that's the same trend, and we're going to see. So when we do decide that the veterans benefits line should be reduced, we're likely going to see the medical services reduced as well. The veterans support services are things that aren't covered by the veterans benefits line or by the medical services. That would be electricity, food, furniture, things of that sort, and that's about 20,000, 15 to 20,000 through FY20. Excuse me, through FY21.
Any questions? Council Brown?
Francisco, how many veterans passed away due to COVID this year?
That I know of, 53.
53?
And of course, I was observing in the newspapers, and albeit I saw flags next to the obituaries, I can't confirm in those situations whether it was COVID-related or not. But the ones that I can confirm are 53.
Are you saying 53 out of the Soldiers Home?
It's a mix. It's a mix.
What was that?
It's a combination.
And I got one more question. So have you, I mean, I know in the past we've talked about an additional staff member in your office. Is it still you alone?
Correct.
So, and we have all this extra money, we haven't considered a part-time person to come in and help you? I mean, the money's there.
The money's there for services.
Correct.
Not
That
for-
would be a
not for-
service.
Not for salary.
No, that would be a salary expense.
Complete different line. The money is what, the services or the amount of, the money that is there is so as Francisco can respond to those inquiries and cases, basically.
So that leads me to my last question. So how much time when a veteran do you get a chance to spend with him or her? I mean, is there
I mean, I did.
amount of time?
Yeah, I mean, I submitted to Tom a while back and the leadership, a time analysis. And on average, I'm allotted at that time, not now, about 7 minutes per veteran per month.
So you really don't have it, I mean, because you don't have anyone, you
It's
have
probably
an overload
improved.
for your time
If
to
I were to
serve.
do the analysis again, the time would probably improve. But, it's never really been, in the almost 15 years I've been here, it's never been a 35-hour-a-week job. It's just impossible.
So you do
And
more
that's
time than
just,
that?
the commitment.
I'm sorry, did you say you do more time than 35 hours a week?
For 15 years, yeah.
I'm only just playing devil's advocate here because I know we were talking about that. I'm just afraid that even during this past pandemic, there was veterans trying to get in contact with you for services, and because you was limited getting to them because you only had a certain amount of time in that week, it just goes to show, again, that I think your office is understaffed and we're not really offering the service that we fully can to our veterans. And I just don't want to, I would like to see us really think about that and try to offer veterans, and especially what you just said, with the affordability of the housing for veterans, and if they come in here, it's going to be a heavier caseload. Just my opinion.
So I think that's a fair point. I guess taking that and the president's comments about there seems to be more money and benefits than you really need, I do think this coming year, FY22, the first non-COVID year that we'll have, in essence, for a while, we're going to get a sense as to what is the workload here, what is the level of service that we need, and I expect this budget will look different when it's submitted to you in FY23.
With a staff, hopefully. I know we don't have a lot to say on that, but
Depending upon what the demand is this year. I mean, if it turns out that the demand is dropping precipitously, and it's not, I don't know that there'd be a need, and it may be just that we're reducing the level of the benefit appropriation. So I guess I want to see what occurs in this coming year, and that will inform what we do going forward. I hadn't wanted to make drastic changes yet. I wanted to kind of, as I said, we thought about this and made a determination, let's keep the status quo here. Let's see what occurs in FY '22.
And to Tom's earlier point on what was budgeted here when he arrived, I can tell you that in fiscal 18, the actual expenditure was $407,000 on the Veterans Benefits line. The next year, 2019, was $275,000. 2020 was $228,000, so the trend is downward, and we have expenditures for '21 that will be very close to what '20s are. So '22 would be a good measurement year to determine what we need to do with all three of these lines.
Councilor Robinson?
Just as an example, he could be at the soldiers' home. He could be tied up there all day. I show up as a veteran needing services. Now I have to wait possibly to the next day when I have an emergency and there's nobody there to respond for me.
Well, I mean, there's an administrative division in HHS. I'm not sure how that's applied, if there's any outreach capability beyond just showing up. I don't know, but Francisco would have to speak to that.
Sure. Margarita was great. She sometimes would help on certain projects, with veterans. So she would know some of the answers. So when veterans would come in, she was great at supporting, and they've already attributed her to Veteran Services. Because Margarita Franco, she just retired.
Just retired.
But the thing is that the numbers.
So we anticipate the person who replaces her will be just as good.
The numbers don't really.
She is getting replaced, though, right?
Yes, she's in the budget.
I just want to clarify that the numbers don't not really represent the caseload, because traditionally it was counted by people who qualify for Chapter 115, but then the job description says I have to help out and help them do their VA claims. So now that many of the elder or older veterans who got priced out of the community were replaced by many younger reservists who might not need the financial support side, but I'm still obligated to do their claim. So it turns more like a paralegal situation where you're coordinating evidence from St. Louis, from the VA, from their medical doctor here, and their medical records to put together these cases. And we've been relatively successful in getting disability claims for each and every one.
So just to address my colleague's concern, your office or your desk is located off of the Bellingham Street side, correct? And when you're not there, that doesn't mean that someone can't leave a message for you, usually someone in the office. Is that the case? I just want to make sure that...
Yeah, we've during this past year, we've definitely tested that, and we've been able to provide support and response. Immediate, I can't say that, but...
But there are times when you have come back and there's been a message by someone dropped by, you need to follow up with them, and...
To the best of our ability, yeah. Maybe not the same day.
No, but what I'm saying is I want to make sure that, that the picture that Councilor Robinson had, that we may end up having to request the city manager to have someone man your desk when you're not there, but you're saying it is currently a system in place. The other employees that share the same workspace that you do handle possible walk-ins when you're not at your desk, and they take the
Yeah, they'll take
information.
messages, they'll accept paperwork.
Okay.
And that's the expectation, that the administrative support person that we hired to take Margarita's place will be supporting this office and others in that Health and Human Services realm.
Okay. Councilor Recupero.
I got a couple of questions for you. One, I see here, the goal is to launch a veteran business group for veterans in Chelsea who are interested in starting their own businesses. Does that include trying to help them monetary or just talking to them? Because talking to them ain't gonna do anything. You're gonna goals? Are you trying to get some funding for these veterans that they can go out and try a business? It's not just gonna be where you're gonna talk to them and say, well, we can teach you how to do it. Telling somebody without money is doing nothing.
Unfortunately, that particular part of the project's been placed on the back burner a little bit, because we've been trying to keep up with some of the other priority issues, you know, with the state reimbursements and getting some of the evidence that we need to help out some of the veterans who are more in crisis. But the concept is to bring in people from the VA and people from the Small Business Administration and present sort of like a 18-module experience and training that will eventually lead to them being able to access the funds that they need to establish a business.
In other words, the people what you're trying to accomplish is get people to help these veterans go to the proper channels to get money, to start their businesses. Like, our city is not gonna contribute, your services is not gonna contribute. You ain't looking, like, you could ask the city manager if there would be some type of fund where we would approve that, or you come to us, that would help these veterans that are starting, they want to start businesses. Like,
Correct.
you know, we give businesses money now for COVID-19, so if there would be something for veterans, which you don't have that type of program now, where a veteran can come to you and say, I would like to start a business, can you help me? You couldn't do nothing for them, right?
Well, I could send them to people who could put them on the right track. There's other existing groups that are already doing this outside of the community, so I would refer them to a group maybe in another community that close by.
I understand that, that's what I'm saying, within your service itself, you don't have any funds to help them.
Oh, no.
But would you like to get some funds where the city itself tries to help the veterans that are from this city? You know, veterans that live in our city, that are starting, they want to start businesses, and the city would try to help them to do something like that. There would be a good thing to try to help the veterans that are here, not veterans from all over the state, but just veterans within this city itself that are trying to start a business. Will come to you, but right now you ain't got no money. You ain't got nothing. But would you like to see something like that? You're proposing it here, but here you're proposing just talking. Talking, it doesn't do anything. Money talks. Talk, don't do nothing. So, if you were trying more or less, would you like to see something like that with the veterans in this city?
From what I'm understanding is, that model definitely is appealing to be able to provide resources to veterans to help them start, you know, an enterprise, entrepreneurship. I couldn't say no to something like that.
Yeah, but there are other factors, though, that would have to be considered. I mean, is it state reimbursable, yes or no? Where's the funding coming from?
I get what you're saying. So, we give the veterans money, right? But the state reimburses us on the money that we give them.
For
So
something.
more or less, if you were gonna do something like this, you would have to run it through the state, that they would give some funds back to the city?
That would be my preference, yes.
I don't think that kind of program that you're describing is a reimbursable program.
But it could be done, let's say if the state decides it's not gonna do that, could the city itself provide some kind of financial assistance to veterans that would like to start up businesses?
You could create such a program if that was your preference as a company.
That's what I'm asking, if it's feasible for you. Right now, we have no program like that, but that would be just for the veterans that live within our city. Right there, a veteran can come to you and say, listen, I wanna start a business, but I got no money. You will say to him, I'll go to this place, I'll go to this place, but the city itself cannot provide money. But on the other hand, on this side, you have veteran benefits, which is $320,000, so the city does provide money for veterans in need of money, but the city gets reimbursed from the state. So now, in other words, what I'm trying to say is, if us, or one of us proposes something like that for you, right? And the state's not gonna fund you, would it be a good thing for the veterans of the city to have something like that?
Council, I'm going to cut you off because I'd like to just focus on the actual budget and what is proposed in front of us. And it's not there and not creating something new. That is a totally something. It's you're talking about creating something, a new complete program. So I would say to stick to this, what's in front of you.
Okay, so here's another question. Over here, you have 320,000 proposed veterans benefits. So and last year was 320. So that means you didn't get no new veterans coming to you for veterans benefits? You did, the veterans
No, I
in
think-
this city, did more veterans come to you, or did it decrease?
No, what we're saying is, we didn't spend anywhere near 320,000 last year. We've only spent, according to Ed, so far through 10 months, about 168,000. So there's a lot less demand from veterans for this reimbursable expense pot of money. We've kept it at 320 because we don't know if there's some portion of that is due to the impacts of COVID, that people aren't coming out, people aren't showing up here for whatever reason because of COVID-related impacts. And it may change, and we may get back to a more normal level of service and demand on our Veterans Office in fiscal year 2022. Or it may turn out that that's a permanent reduction in the number of veterans coming to us for service, and that line item can be reduced starting in FY23. So the answer is there's been less demand for those kind of benefits. But as Francisco mentioned, he's also getting demand now from veterans who don't qualify for that, but are looking for his help and assistance in applying for other federal benefits, and he takes some of his time and energy doing that. They don't necessarily draw down on this pot of money, but they still require his time and attention as the Veterans Affairs agent.
Well, one more question. And on medical services, I know you spoke about it earlier, right? It's 95,000. Is that just medical service for counseling, or medical service for hospitals, or medical service for everything? What does that consist of? I know earlier you said,
It's
for
prescription,
counseling and stuff.
Counselor, it's prescription drugs, it's medical appointments, it's dental appointments. It's different things that the benefit, that the veterans will need in support of their medical needs.
So when the hospital will open up, would they be able to go to that hospital? Like these medical services of these people that you buy in drugs and all this other stuff, right? When the hospital opens,
Well,
would
one of the
this go
things-
to them too?
Yeah, well, one of the things we have is over here at Margolis, our clients can go there, get prescriptions. We cover the co-pays. We have a Tufts complement insurance plan. We pay those premiums for them. We reimburse them for their Medicare co-pays, Blue Cross Blue Shield, dental, dentures and things of that nature. So it's pretty varied. It can be a lot of different things, but they all fall under sort of the medical category.
Thank you.
Any questions, Councilor Lopez?
Yes, on the medical expense, again, that he was talking, this service is for veterans that they don't go to the VA hospitals?
No, well, one of the things we have to keep in mind is that to be a client of the, Chapter 115 services, you don't have to be a veteran. You can be a spouse, a widow. So any widow or spouse, you're not eligible for VA services. You can't, they just don't provide them. So in most cases, they're widows that are getting non-VA services, medical services.
Who do you report to of your office? Who's you report where you do?
Currently, I'm reporting to Ned, but also too, I have to respond to the new superintendent, Eric L. Johnson, at the Soldiers Home, but also too, Secretary Cheryl Poppy. So I answer to quite a few people.
But if you're asking in
In
our
this
city
particular-
hall, yes, so all of the former department heads who were previously reporting directly to Louise, they are now reporting to Ned and myself. But Ned is really acting as their direct report for the most part.
Awesome. Thank you.
Seeing no other questions. Thank you, Francis.
Thank you.
So the library.
So unfortunately, Sarah is ill.
Okay, lucky her.
I did send the council, so her budget is pretty straightforward. It really has not changed at all from FY '20 to FY '21.
Yeah.
From FY '21 to FY '22 as proposed. The only change is in salary, and those are contractual salary increases. It's the same number of employees, same positions. She did send to us, and I forwarded to you today, her sort of reopening plan come next week, and that's where she stands as of June 1. We'll do the same thing with Senior Center. There'll be some shifting starting next week, but Tracy, Ned, and I are going to talk this week about what exactly we do in there. But this is Sarah's plan come next week. Ned or I probably could answer any question you have on this budget, but as I said, it's pretty much exactly the same budget and has been virtually an identical budget for the last 3 years, the only exception really being the salary changes that have kicked in.
Okay. We're good. Next.
So,
Community schools.
Yep, Recreation and Cultural Affairs, and that's on page 163.
$163. Good evening, B.
Good evening, everyone. My name is B. Cravata, and I'm the Director of Recreation and Cultural Affairs, which provides year-round recreation, education, and cultural opportunities to residents of all ages. In a typical year, we offer over 200 programs. We schedule and manage community use of the public school facilities, and we issue permits for the use of parks, fields, and other public spaces. We also provide staff to assist an advisory board, youth commission, and a local cultural council. There are 3 key values that make recreation and parks essential services in our city. The first is economic worth or economic benefit. The second would be health and environmental benefits, and also number 3, social importance. I believe that the strength of a community is increased through recreation activities, which allow people to share their culture and ethnic pride. In terms of our budget has increased slightly, $34,163, and that is because for contract services, we've increased it by $8,500 to support our registration and web conferencing software. Our youth programs, we've increased about $30,000. La Colaborativa, the Summer Youth Employment Initiative, is about $15,000. We're providing, and also a Green Roots, the ECO program is $5,000, and then we have also our martial arts and dance programs, which is about $10,000. We also have a slight decrease in our salaries, but that's because FY21 had a 53-week payroll period, and in comparison to FY22, which is only a 52-week period. So in terms of one big accomplishment for FY21 of last year, we pivoted very quickly and seamlessly from an in-person to remote offerings. Over 1,100 community members participated in approximately 105 no-cost live stream classes, and I want to say that they were all free. And during spring 2020, 570 residents were issued credits and/or refunds for any of their classes. And I want to again thank my staff over and over. They were extremely talented and hardworking during this time. And as I look to FY22, we want to continue to broaden our offerings to develop new partnerships and provide programs that address the interests of Chelsea's diverse community. And one way we're going to do this, and we're working on this now, is to work more closely with Chelsea Public Schools, Buildings and Grounds, to expand public use of municipal athletic facilities, develop a resident permit insurance guide that outlines event types, regulatory compliance, and insurance requirements. So I think we've come a long way. We have a long way to go, but I do feel very comfortable and promising for the new year of the changes that we can make.
Councilors, do you have any questions? Councilor Recupero to the budget.
Over here it says youth program. It increased by 13.3%. What did you increase?
Sure. For the youth programs, we increased it by $30,000. The Summer Youth Employment Initiative, we've increased them $15,000. And also Green Roots, their youth program ECO was $5,000. And then we also wanted to have support for our very popular martial arts program and our dance program, and that was $10,000. It was $4,500 for martial arts, and for our dance programs, $5,500.
Another question. Here you have art recreational manager, but there's nobody there, but it's $63,584. Who runs that? Who's in charge? Who's that?
So right now we have one community recreation manager, it's Omar Miranda, and we are looking to hire a second person.
What's his name?
Omar Miranda.
Omar Miranda? So what
Omar.
does he get? $68,775 and $63,584?
So
Is
that,
it the same guy?
no, Omar gets, that is, the 68,000 is the salary for Omar. The other position is open. We had an employee, Natalie Pardo, who left, and we are in the process of filling that position. So it's vacant at the moment, but it is a position that we need to fill.
So at the moment, this gentleman is getting two.
No,
No,
it's
no,
one
no.
pay.
Just one, right?
Just
And
one.
this other position you're gonna fill.
Correct.
Yes, we've already have it posted.
So you're missing another position here too, right?
We are. We're also, we've had somebody in our billing department, if it's billing, she has retired, and so that will be called permitting and billing, and that will be a part-time position, and we will be hiring for that. We also are going to be needing to hire for our program assistants, because many, again, either have full-time jobs, they left for the school department, retired, and so we're going to have a busy summer hiring staff to come on.
Is that why your budget increased to $731,000? Are these new positions you're making, or these are the old positions that you're
Yeah.
refilling?
Yeah, we're not adding a single position to this
No.
department. These are just existing positions. The salary number in this department is actually down. The thing that's up is almost exclusively as a result of the addition to youth programming, and that is because we gave some additional money to some of these summer job efforts from La Colaborativa and Green Roots. And we did that in part for them to offer more positions, but also in part to cover the increase in the minimum wage, which if we hadn't done that, they would have hired less people than they did last year. So to cover the minimum wage increase, we had to increase the support for those programs. But her budget does not reflect any increase in salary. In fact, it's a slight decrease, and there's no new jobs in this department.
All right, thank you.
Councilor Taylor.
I just want to follow up on that briefly. The additional funding for the youth programs, How does that program work? Where do these kids actually work at?
So, in the case of La Collaborativa, we simply supplement the money they get from the state. They get another chunk of money for the state from their program. We supplement that with $165,000 of our own money. They get kids through an application process, all Chelsea youth. In fact, the lottery for their program was just held up here last week. Green Roots, I don't know the specifics of how they go through their selection process. I believe it's a similar application process for Green Roots. They have a similar summer youth echo program where they're hiring, again, all Chelsea youth exclusively. So we previously were giving them $20,000 a year. We bumped that up to $25,000 for this year. We were previously giving La Collaborativa $150,000. We bumped that up to $165,000. You have a further proposal before you to bump that up even further, which I believe is coming before you on Monday, June the 7th.
And how many youth does that service?
I think they're looking at it, when I'm speaking to them on the, a couple weeks ago, close to 200. I mean, they're expecting
They had
quite a few.
550 applicants, 200 were chosen on the current number.
200, am I right? Yeah.
The additional money
And-
could lead up to
But
an
what do they
additional
do?
50.
What do they do,
What do the students do?
the applicants?
They are placed in a number of different offices and employment around the city. They work with the Chelsea Chamber. I'm not sure if the Chelsea Chamber is working this year, but they've tried to work with the Chamber in the past
To
in
provide the
finding
jobs.
locations for them.
We
Yeah.
take a few here at City Hall.
We're doing one, we're having an intern to help Fatima this year.
Right.
Issue,
What, are you done?
sorry. Okay. The second issue, it always seems to come up at election time, that we have these kids out there running around supporting candidates, which I don't think should be allowed. And it should be made clear to those groups who are getting city monies, that's an activity that's not allowed.
They have no new framework that they're using for youth employment, and it's in 3 tiers. So it's like the first tier is for like 14 to 15-year-olds, and then the second would be 16 to 17, and then 18 to 20. But in those tiers, they're calling them interns, and they're looking at different types of jobs specifically for them. So it's like 1 supervisor to 12 or 15 students, or interns. So it's really different. Years ago, we could have 3 or 4 people with us, and they're kind of looking at a whole group. So they've got a lot of work ahead of them, but this is probably going to be the first year that they can see it, post-COVID, and see it work.
Council Brown?
I didn't have it, I have one now. So, you say they, can you explain who are they?
The collaborative?
Okay, but we're talking about 2 agencies, right?
We're talking about La Collaborativa, and right now it is, there's 2 women that are the staff that are
But
overseeing.
it's 2 agencies, so when you say they, do you mean both of the agencies?
No, when I say the word they, I'm thinking of the 2 women that are working on the program.
Okay, on what?
On the Summer Youth Employment Program?
Okay, so the 2 women that's working on the summer youth program, they define a 3-tier something?
They have a new framework that they're working on.
Framework, and the 2 organizations that get these students, they have to work with
Well,
that
they're looking
framework?
for placements right now, and we're going to have Tenacity from Boston come, and they'll be at Vogue Park this summer starting at 9. We would have loved them to be with us, but we needed only 4 summer workers, interns, and they really needed to place like 12 to 15. So they're looking at, capacity is big of where they're going to place people. So it's going to be fascinating. It's really different, and they're incredible, capable women who are going to be overseeing it. So
So do we have a list? So we have a list, I think I heard someone say there was 500 applicants, but only 200 was accepted. Do we have a list of those names and those addresses, those students? Is that something we keep?
Yes, we don't have it.
You
but
can't-
The
you can't have
collaborative
that.
does.
Why can't you?
Because it's underage, it's information privilege. If we got a communication from a kid, we actually can't even read the letter. They're underage, we're not allowed.
You would have to have a social security number if you give them a check.
But that's, what I'm saying is, the employers can have that information, but you,
Well, we are the employee. That's my question. Are
The
we
employer is
No,
a
we
third
don't
party.
employ any of these.
We don't pay them directly, we pay the agencies
Okay,
that pay them.
so, all right, let me back up then. So we give two groups checks, and nowhere do they say the city of Chelsea supported this, correct?
all over that said it, that's supported.
Well, I wouldn't say that, they receive
No,
a
no,
check
no,
from
I
the
just
city
wanna
of
be
Chelsea,
clear.
so
I'm just trying to be clear.
there's a
I'm
contract that
trying to
they submit through the procurement office that indicates that there's a contractual arrangement between the city and the agency. The payments that are submitted,
I just want you to follow me a little bit. So we give two checks to two organizations to hire kids.
Just
Those kids are employed by those two organizations, correct?
yes.
And that's what they know, and that's what they think. They say, well, these are the folks that hired us, and these are the folks who paid us. They don't say anywhere that this money is supplemented by the city or the state.
I'm not sure of that, I wouldn't know that.
That's my point.
I don't know, it's not a requirement of their
Yeah.
contract that they publicize that. The city is making a policy decision to support summer youth. We do it by supporting agencies that hire summer youth. So we give money to the La Collaborativa for this purpose, and we give money to Green Roots for this purpose.
But it's a policy that the city is supporting the youth, but it's not a policy that the city is paying directly towards the youth, because we're paying on two organizations.
Correct.
And I'm just
That's
trying
right.
to figure this out.
Right.
Because I know it always come up, and, again, because if they're allowed to do certain things, it's not because the city doesn't want them to do it, because the city doesn't allow them to do it. It's only because what the groundwork, what you were saying, the 3 tiers are. 'Cause I don't know what the 3 tiers
So,
are.
Counselor Brown, I wanted to just correct for myself, just for clear for you. Yes, there's two agencies, Green Roots and La Collaborativa. When I was speaking about the summer youth employment, I was specifically thinking of La Collaborativa and two women working on that. And it's short term, it's the summer. But I think ECO goes a little bit longer. It doesn't necessarily just go for the summer. And, people are working with them there. So yes, there are two, and I was just focused on the summer portion.
Well, my confusion was because my colleague asked what they were doing, and I didn't understand what they were doing, but I thought the tier was going to define what they were doing.
Yes, with these tiers, and I'm learning about this too. This is all brand new. With these tiers, the tiers are the age group. And then they're looking at, whether it will be STEM, or will they be working in mental health, or whether it will be working in, for finances. They're looking for agencies or organizations that will take on those amount of students and work with them through the summer and help intern them. And they're making progress. They're finding and reaching out. So we don't know that as of yet where they are, but.
I fully understand that, but when I said if we can get an address, a name of where they work at, live at, my colleague, the president, said we could not, but we can entrust them in working in mental health and other organizations that maybe they're not specialized in. So there's a liability to have someone out there working to do something that maybe they don't specialize in. And the city is supporting it.
Yeah.
That's why I'm
Original question was the fact that these kids should not be allowed to work on campaigns
Yes.
during the summer that we're giving money to.
So let me respond to both. So in terms of, we certainly can ask La Collaborativa to give us a list of the locations where their 200 persons are being assigned. I can't imagine that they'll have a problem identifying for us these locations, some of which will be City Hall department offices. To your other question, Several years ago, the council raised this issue,
Yes.
and the city had a specific conversation with La Colaborativa, and they committed to the council in writing that none of their students that were supported by city funds would be used in any election-related activity, and they gave that in writing to the council. I would say that was probably 2 or 3 years ago. You received a direct letter because they made that strong commitment to the city in response to that concern. It is my understanding that they have maintained that commitment. They put it in writing to the city. I can reaffirm that with them, and I'm sure they'll make that same commitment. But they know that that's a concern of this council, and they have previously committed it would not happen.
That wasn't my direction. My direction was that the city council vote for money. We make appropriations for the summer youth programs. And that I just think people would understand it if we still was aware of what was going on and who was being hired. Because we all up here want Chelsea kids to be hired. So that's all we want. Everyone up here wants Chelsea kids to be hired. And if we get the agreement, everyone's being hired from Chelsea, they're high school students, we know that they got good supervision, we believe in both of the organizations, but we just need to know that, these folks are from Chelsea.
Oh, that is a condition of the money, that it can only be used to hire Chelsea residents. I have no concern that that is not being met.
I just need to make a statement before this conversation, which I feel has already gone off the rails and has been met with uncontested for some of the direction that the conversation has gone in. First and foremost, there was only one time that the collaborative got in trouble, and I say fairly, for allowing youth to participate anything remotely political. And that was when, during hours, they took a bunch of kids to a protest in Boston, because at the time we had then City Councilor Roseanne Bongiovanni on the board, I believe, and they were protesting the coal plant that was going to be over at Eastern Avenue, or across from where they're now redeveloping. And they, deservedly so, got in a lot of trouble with then city manager. That was the first and only time youth who were in the work program used. Aside from that, so don't go out making predictions or stating that someone got in trouble over something that happened over 10 years ago. You'll get your piece. So first and foremost, it happened once and has not happened since then. If you want to talk about what happened years ago, we had 2 counselors here who asked for a motion so that any programming by the Collaborativa and any programming they could not do, because they also had money for voter registration, they wanted to make sure that the Collaborative was no longer going to do voter registration, even though they worked with Mass Vote and has been consistent in registering voters. That was something that was asked by 2 counselors who didn't agree with the politics or the involvement of adults in that organization. And I remember sitting here that night, and I remember the order going on that night, and it went uncontested. And I thought, there's something on free speech. Because today, I would say that not allowing any agency to go out there and register people is a mistake. Registering to vote. I don't want this to make, because the appearance right now is that you are making it sound like youth are being taken advantage of and being used for political reasons, which is not the case. I want to make sure that is clear, and I want you to recognize there was one instance, and that has not happened since then. And the incident that the city manager is talking about, the agreement, had to do with 2 disgruntled city councilors, one who particularly was upset, and now I say we're all paying the price. The community is paying the price because we no longer have mass registrations in the city. So if you want to answer to that, feel free, but state fact and not innuendos.
I don't think I was going there. I asked a simple question. Okay, the fact of the matter is, somebody called me to ask me to ask that question. So therefore, I put it on the floor. I wasn't going anywhere with it.
Well,
Just the fact that, wanted to make sure that it was stated for the record.
Yeah, I think they're clear on both issues, that they're not engaged in that activity, and all of these youth are Chelsea youth. They are clear that the city of Chelsea is not paying for them to hire youth from other communities, and I can assure the council that neither organization is doing that. They're all exclusively hiring Chelsea youth.
Council Brown, any questions?
I'm all set.
Anyone else?
Turn to the wrong turn for that.
Councilor Recupero.
Over here, right, Ms. B, on contract services, right? You increased 6.4%. What kind of contracts, to what? What is it, to vendors?
Yes, that's a very good question. In order for us to have online registration and to have a database of all the people that are wanting classes, that we have to pay a fee to Capture Point Community Pass. That's our online registration. That's around $4,500 a year. And then we also had the Zoom and an educational license we needed in order to be able to do all the remote programming. And so it's additional money that was placed for that. It came out to be $8,500.
Thank you.
You're welcome.
Seeing no further questions, B.
Thanks, everybody.
Thank you.
So nice
Continue
to
the good
see you.
work.
And thank you for all you do. Thank you very much.
So next up is the assessing department, Jim Sullivan.
Go ahead, you can continue. That's fine. I was gonna get it.
On page 47. 47, 47.
I saw that. I won't be using it.
Went right over our head.
So what page are we going to?
Page 47 in the budget book. This is the assessing department. Page 47.
So before we start this, I just want to clarify something on page 48 and the salary line item. You'll see this large percentage change, but this has to do with a mistake that we made in the FY21 budget that I think I pointed out to you last year. We had neglected to include the salary of the Director of Assessing last year. And I had said to you that when and if we hire a Director of Assessing in the course of fiscal year 21, which was our goal, we would have to come to the council for the salary number. It turned out we have not yet been able to hire a Director of Assessing. This year, we included the full salary for that position in here. It is our goal to hire a Director of Assessing. We are still actively seeking one, but we certainly won't have one by June 30th. So this will all be for FY22. But there are no new positions in this budget. It is just that last year we neglected to fund one of the positions. So that explains the large salary increase year over year between FY21 and FY22. The other changes Jim can comment on in the operating line items.
Okay. I'm Jim Sullivan. I'm the interim director of assessing. In our department, we value the 6,553 properties, personal properties. We do excise tax, things of that nature. Basically, a revenue center for the city on our personal and real estate tax. We have an office of currently 3 people with 1 opening for the director of assessing. And as Tom had mentioned, there was obviously the only substantial increase in the budget from last year to this year is the inclusion of the director's salary. So everything else has pretty much stayed the same. We've held down the fort despite not having a director in place. And all expenditures stayed the same. We were able to accomplish our goals throughout the last year, being shorthanded and during COVID. The only real issue we had, we weren't allowed to do interior inspections, but we were able to function, and the office was only shut down for 2 weeks during the crisis. Other than that, we're in the office every day.
My first question is that you expect to have the inspections to commence this year?
We can start June 1st.
So June 1st, you'll start to begin inspections on ground.
We can start the cyclical inspection program June 1st. We rephotographed and did exteriors on thousands of properties during COVID. But we can satisfy the DOR requirements, start to do the sales inspections and qualifications as of June 1st.
Under normal circumstances, who's doing the field work when the position of the director of assessing is in place? Is the appraiser and the assistant assessor both doing field work?
Correct.
Okay, so normally so there's two field officers.
The majority of it, the residential stuff, the appraiser will do, and I'll go out and do more.
I'm sorry, the majority of the residential?
The residential stuff that the appraiser was doing, and I would do the commercial stuff, the commercial properties.
All right, but the office manager just handles inside, and the part-time assessor, part-time associate assessor, am I reading that line, number 2? What is that? In the graph on the organizational structure?
Oh, those are just board members.
Does board members?
Those are the 2 board members of the Board of
So
Assessors.
you consider them as staff because they're paid?
They get a stipend, yes.
They get a stipend of being on the Board of Assessors?
Board of Assessors, yeah. They're our only board that gets a stipend here.
Is that common?
It's, to be honest with you, in my prior experience, every board member got a stipend on every single board.
Okay.
So it was common for stipends to be given to all board members across the whole field of boards. So this is not uncommon, for sure.
Mr. Ambrosino, we haven't had an update in a long time as far as the search for the Director of Assessing. So has there been any movement whatsoever?
It is a very difficult position to fill. There are at least 2 other communities, probably more, out there actively seeking directors of assessing. Salem being one of them that I know off the top of my head, but I believe there's at least 2 others. This is a very, narrow field. There aren't many people qualified to do this work, and it's just difficult to find appropriate people. We've made 2 offers to people who looked very promising, and at the end, they decided to stay with their existing employers. So we actually we've hired a headhunter. We're prepared to pay a headhunter 20% of the salary to find someone. So they're actively seeking applicants for us, but at the moment, there are no good leads, unfortunately. And we are paying pretty good. I mean, this is a competitive salary. So it's not the salary. It's just there's not a whole lot in the world out there.
This is the residency requirement?
The residency requirement isn't impacting us here. I will tell you definitively, we will need to waive that.
I did check, there's only one certified appraiser in the city of Chelsea.
What was that?
There's only one, since I moved out of Chelsea, now there only remains one certified appraiser in the city of Chelsea.
So I do want to say that we are, we're prepared to make sure this office works, and we have, one, as you know, we have hired an expert that you funded to expressly look at the 336 odd 4+ units in the city and to properly value those multi-unit residential buildings. So we will do that. We will probably use some of the contract services money that's in here to bring on some other professional assistants to sort of fill the gap of the lack of a chief of assessing until we find one. So we will meet all the requirements of this office. It will just be more of a Band-Aid effort until we get a chief of assessing, which I'm hoping we will find during the course of FY22. But as I sit here today, I don't have any good information.
Tom will ask for a job transfer. Can you provide, you touched upon the free cash allotment to pay for an outside firm to come in. Can you give us an update of where we are right now?
Really, he's just in the beginning stages. Yeah, we actually just signed the contract maybe a few weeks ago, so he's just getting started. But this is a real professional, and he's about as good as anyone in the Commonwealth. So I feel pretty confident. He's confident he will get the job done in time, and we're meeting with him regularly. We have at least a monthly meeting to just make sure he's staying on track. So far, he seems to be on track, but really is just at the beginning stages of doing this work. I just want to, it was overlay reserve.
I'm sorry, what's up?
It was overlay reserve you appropriated the money from for that purpose.
Right. At this time, if my colleagues have any questions?
Yeah, I got it.
Council Brown, Council Recupero afterwards.
Thank you. Thanks for being here, Dan. Can you tell, and I know you're very young here, can you tell me if you got a plan or some goals, because this council member body has always questioned why our properties are not, assessed up to date, and how can you remedy that, like work to get that information to us and also to the property owners. I know a lot of folks hear about what their property will sell for, but the assessment and the value, the market value, somewhat always apart.
Sure. That is obviously something we looked at. The prior assessor had taken that, was given that assignment right from the beginning when she started. So all the residential properties, the 1, 2s, 3s, condos, which is about 80% of all the properties in the city, are, in my opinion, fine. I don't have any issues with them. We're not here to overassess people or underassess people. We're just there to treat them fairly. We have issues with some of the commercial properties, and the main factors we're looking at, and that's part of the project with the apartments, are the rental income, the operating expenses, the cap rates, and the vacancy rates. We're looking at those factors and review them. What we have to do in order to get through the red tape of things that weren't done in the past, we can't just make drastic cuts in a cap rate. So we might have to look at changing the model structure of our CAMA system. And I had spoken with a gentleman the other day. Essentially what this office really is to sit down. We have an expert that I know. We're going to speak with him. He's been
an expert?
He is, yeah, he's been assessing for 40 years. Fantastic, knowledgeable guy. And how we can change the model structure of the CAMA system to get those changes in place. It's not as simple as just, we know what the values are, we know what should be, we know what the cap rate should be, but there are Department of Revenue requirements we have to follow, and we don't want to create a frenzy on abatements or people saying, my building went up, 60% this year. They're gonna go right to the appellate tax board, and appellate tax board's gonna be overwhelmed with cases as it is. So we have to do it, we have to have a strategy for this office. With the, one thing, statewide, there are 20 openings for assessors, and this Department of Revenue is also hiring. So the competition statewide is tremendous to get somebody qualified. And most communities don't have assistant assessors. They'll have a clerk and an assessor. And now as all the assessors are retiring around the Commonwealth, there's nobody to backfill. And the appraisers that are out there, they're making good money right now. They're not gonna come in, and an appraiser, like my background is appraising, I can come in and do valuations. I don't know the Gateway and the DOR systems. It takes a while to learn them, to be exposed, because you only do them once a year during the certification process.
So if we're 4 or 5 years backwards in assessing correct assessment, doesn't that hurt a city like us? So that's why I think it's important for us to warp speed, and that's why I want to see what you.
And that's why, yeah, that's why we're having this discussion with this gentleman, and hopefully we can announce it next week.
Yeah, so I think we've realized there are 2 places where we need to put some attention. Multifamily units, and we've hired someone to fix that problem, which we think we can fix in FY22. Then we have this commercial issue that needs attention. We're not gonna be able to fix that in one fiscal year, but we're going to bring on board some expertise, similar to the expertise we brought on board for multifamily properties, and start the process of trying to improve the way we are valuing some of these larger commercial properties.
Is there resentment, Mr. Manager, from the owners that we're facing, other than just being able to evaluate correctly?
Anytime anyone's value goes up, they're not happy. That's true whether you're a single-family homeowner or a owner of a large commercial building. What we're trying to do is assess properties fairly. As Jim said, I think we feel that our condos, 1s, 2s, and 3s, are actually fairly assessed. I'm not sure we feel as confident with the current assessment of some of our multifamilies and some of our larger commercial properties. And that's where I committed to the council we would put our attention. We started with the multifamilies. We're now going to turn our attention to commercial properties. I think we can pretty much get a resolution on the multifamilies in FY22. I think the commercial fix is going to be a multi-year effort.
Thank you, Mr. President.
Councilor Recupero?
I have a few questions. Overall, your budget didn't go up high. Everything seems to be zeros. But here's a few questions I have. You hired 2 part-time assessors, right?
No, those are the board members,
Those
Counselor.
are board members. It was explained earlier.
Part-time associates.
Yeah, they're board members.
These are these.
I know, they're 2,000.
They've always been there, they're board members, they always get a stipend.
Board of
they always
Assessors.
been there.
We said it earlier.
Okay, that's like the old guy that used to be there before, they're consultants.
Yep.
All right, so but here's my question I want to ask you, right? In the near future, do you intend to make a few more positions in your office so we don't have to pay the money that we're spending, like Mr. Tom gave, to come out? Right now, we gave you money last year for that. So here's my point. Is your office, do we have to go each year and hire out? Are you going to try to make some within your own office so we don't have to hire out?
I think that's exactly the goal, is to try to hire a highly qualified person to be the director of assessing, but
I'm not just talking about the director, I'm talking about more additional help for him.
Field officer. Or are you satisfied with 2 field operators?
I think we
All right,
probably could do it with 2, but I guess I would say I'd like to hire a director and then take advice from that director. If that director came in and said, you could really benefit by having another person, I'd take that advice. But step 1, honestly, is we have to find someone.
But Mr. Sullivan, let's say right now, is the acting director, right?
Yes.
So, I'm leaving the question to you, Mr. Sullivan. Do we need more, or do we have to hire out? like we just did. The question is...
That was for a large-scale project, number one. We need to, as Tom had mentioned, if we get a good director or like this gentleman that I've been dealing with, personally, I think if we have the right people in the right places, we don't need more people. We need the competent people doing what they're good at. And from there, we just need to leverage the latest technology and certain things that we can do to reduce time and effort and resource allocation by using technology like LiDAR to measure our buildings, which would be a great cost savings to satisfy the DOR requirements. There's certain things we need to do in our analysis, like institute maybe Power BI, taking data outside our system into Excel and into an analytical system that'll help us. And those are very cost-effective, cheap solutions. Again, you just need the right people who can do that type of work. The job itself, the principles and procedures of valuation haven't changed. It's basic math and statistics. But the methodology will continue to change as technology changes, and we need to leverage that. There's obviously changes with personal property and pipeline valuations and things like that. We can leverage certain consultants who can increase our valuations. If you see the amount of money we get on personal property growth is tremendous. There's been case studies where companies will come in and evaluate that, and that's how they get paid on a percentage of their increase. And again, they are experts in that field. So I think for right now, we can hold down the fort till we get that director in place, and then have a long-term strategy for the office of getting the cap rates right. And once they're set, we just need to modify those every year. This is a problem that didn't happen overnight, and it's not going to get resolved overnight. I bought my condo in Chelsea 21 years ago. I knew there were issues back then because I was doing valuations, and I know what I paid and I know what I was assessed at. This didn't happen overnight. It's going to take a little bit, but we have identified the problems and where they need to be. Now we just have to get that solution and put it into place. And that's why having this gentleman come on with the multifamilies and speaking with that other gentleman, they can give us a direction and knowledge on their decades of experience to get us in the right place.
All right, thank you, no more questions, thank you.
We'll update those titles for next year on the Board of Assessors
Yeah, I'm
members.
sorry, that should be
missed
board
that.
members.
I missed that. I needed to update those titles, so I take responsibility for that.
Any other questions? Oh, I'm sorry, Councilor Robinson.
How many abatements have been requested?
This
so
year,
far?
we had 165 abatements. We have 130 cases at the ATB, which I think is the state record for this year. So we've been very busy, but I will tell you that a lot of these, in my opinion, are frivolous. We had one gentleman just sell his whole portfolio of apartments for about 30% more than he was valued at, and he's filing an abatement. He filed abatements on those properties. So these are people who continue to come to the trough every year looking for a rebate, looking for some money back when they know they were undervalued. So by taking a strong stance on them, they'll eventually fade away.
Now, the groups who have been doing a lot of affordable housing and with the tax credits, now, have they come in for abatements?
I'm sorry, like TND?
Yeah, like TND or
Yes.
any other groups that are partnered with any other nonprofits?
Yes, they have all, I shouldn't say they all have, but a significant number have. And that will be ironed out with the project that we have in place now. This gentleman will be handling all the low-income tax credits. We have a project in place with Alex Train's group to identify any type of deed restriction, low-income tax credit, any kind of property that is non-market, and what the ramifications or impacts on value will be.
All right, that's my thought. Thanks.
I think that's it. Thank you, Jim.
Okay.
Thank you, Jim.
Thank you, Jim.
Thank you.
Steve. This is emergency management, page 102. Hi, Jim. Good.
What page was that? I'm sorry.
102.
102. Okay.
need more counselors to return before we can go?
Yeah, that would be helpful. I mean, we do have two on the online.
Oh, okay. How can I tell? We don't have a quorum yet, so.
I gotta stay in the room.
We got food back there.
102, sir.
Page 102, Emergency Management, E911. Director Steve Stafford. Page 102.
So I think all of you know Steve Staffier, our Emergency Management Director.
Thank you, Tom. Good evening. Again, my name is Steve Staffier. Those of you that haven't met me yet, I'm the city's Emergency Management Director. The Office of Emergency Management, OEM for short, has 3 divisions that I oversee. Emergency Management, Emergency Communications, which is 911, and Fire Alarm and Telegraph Box System. That's citywide. My department provides critical 911 services to the citizens of Chelsea and critical dispatch services to police, fire, and EMS agencies. The dispatch component of emergency management is the biggest component. My overall budget for FY22 is less than FY21 by about 1.3%. The reduction is shown by both employee and operating funds. We are currently down 2 full-time employees, unfortunately both on FMLA status. One of the other big areas I know that was concerned when I first started was the fleet size of vehicles. Since day one when I started, I've reduced that from 5 down to 1 operating vehicle, response vehicle. In FY21, we successfully deployed a new CAD system, computer-aided dispatch system. That was an investment made in joint with the fire department for fire dispatching. We're able to upgrade the fire department's radio system. In FY22, looking forward, we look to upgrade the police and DPW radio systems with CIP funds and move forward with a new computer-aided dispatch system for the police side of the operation. And any questions you folks have?
Gonna start this side. Councilor Robinson.
Expand on the development of the comprehensive shelter management team and a plan, what?
The comprehensive
Shelter management team and plan.
shelter management?
Yeah.
Okay, that might actually be a typo, because some of this description that's in here for accomplishments and department at a glance, I'm not sure if some of it actually made in there, but it's supposed to be the comprehensive emergency management plan. I just met with the state recently, about 2 weeks ago, because we're due for a citywide update on our overall emergency management plan. Now, within that plan is sheltering operations and so on. So by the end of this month, I'll have the updates uploaded to MEMA, the state agency for emergency management.
All right, that'll be included in the plan.
Yep.
All right,
Yes, sir.
thank you.
Councilor Brown?
Thank you. Thanks again, and apologize, man. Everyone ran out for the same time without knowing. But I noticed you got the stipend for language. How many Latino speakers you got, or Spanish speakers you have?
At this point, we're close to half the staff. There's probably about 7 or 8 of them that are
Yeah,
bilingual.
we're budgeting for 7.
Yeah, yep.
Budgeting.
Yep.
But you went up $300. I mean, it's the same as last year. Is that just to attract more people? I'm not sure what the stipend for.
It's a contractual stipend
Oh,
if you
it's
speak.
Right, exactly.
Okay. And what about the unused sick bonus? It went, it's 800, 1,800 again this year?
Yeah, that's a contractual obligation as well. If
Contractual.
someone has no sick days registered, there's a bonus that's paid, and I believe it's
We
measured
only had 1 or
quarterly.
2 that.
Yeah,
Yep.
it's, there's a couple of people that qualify for it.
Yeah,
next year.
so I really appreciate your hard work over there. I see you spoke about, you went down to the vehicles. I know some of the council members always have, questions regarding vehicles. How'd you manage to just reduce it from 5 to 1?
Well, candidly, there was some relics that were left, obviously, from previous administrations.
Okay, so, but it is working and,
Yeah, I mean, as far as the emergency management side of the house, I'm a one-man band, so I can only drive one vehicle. What was left from previous administrations was more than travel vehicles. There was the investment from 1989 of the mobile command post. So equipment like that, we moved on. And a couple of the vehicles we transferred over to other departments that needed it more than I did.
Okay, I know we just came through a challenging time with the pandemic. I know you had a lot of phone calls and stuff. What was your challenge? I mean, how did you meet that challenge?
The biggest challenge was pretty much day one or week one. Tom says, "Hey, I need you to open up this hotel."
I'm sorry,
But,
the hotel on
yeah.
Route 1?
Yeah, no, and that was a joint effort, teamwork with the city of Revere, my counterparts in Revere, as well as other city partners. But that was a big challenge to get that off the ground. There were some struggles there. The state and federal government saw one side of it, that they had other facilities to use. But in the end, this one shined, and we got a lot of accolades.
It's good work. Thank you very much.
Appreciate that, sir.
Thank you for your patience also today.
That's okay, thank you.
How's that, Mr. President?
Steve, my question here is, or actually more to the city manager. While the proposed change in salaries is a little lower, the actual change in staffing is also lower. And you don't have the emergency management assistant. So we've had problems in the past with this department. As far as having someone second in command, somebody to groom, and when something may change along those lines, we have this in place in the other public safety. If we lose a fire chief, there's someone that can step up from the lieutenants. If with the police department, same thing. That's why we had 4 captains. There was a plan in place years ago, originally. We ran into this, if you all remember, when Alan was our director. Again, nothing. And we had a plan in place, and he was grooming somebody, and then that person left, and we decided to do something again. Despite the fact that we don't have a plan B or even a training in place, our salary is still, salaries count is still up there. So I can imagine that if we were to have a plan B in place and start to groom somebody, you're talking now a significant jump. I'm concerned, A, about that actuality, and 2, that the fact that we don't have a plan B in a department that we had problems with in the past. I'm not saying that Steve's going to jump out and leave us anytime soon, but again, you plan for the future in case something happens. You don't leave us community on the lurch. So can you explain your decision as to why not to have somebody groomed or be able to take over in case?
Yeah, I mean, I think we just are sort of getting used to Steve here, and we talked about whether we ought to consider hiring an assistant for FY22, and I think we had a pretty detailed discussion about that and thought that for this year, he was satisfied. He had some ideas about how he wanted to move the department forward, and we decided that we would simply defer that discussion for next year. And it was just, could have been a position that I proposed for FY22, but after talking with Steve, he thought it wasn't his highest priority for FY22 to hire an assistant. And I guess I'll defer to him. I understand your point that in some sense it's sort of my decision, but I did confer with Steve, and after talking with him and realizing he had other priorities for FY22, I decided not to put that position in. I agree with you. I think inevitably we're going to put an assistant director position in here, and it just is not in the budget for FY '22, but it probably will be something we pursue in FY '23. But I'll let Steve talk about that.
Thank you, Tom. And the city manager is correct. We had an extensive conversation about the assistant position, so we kind of held that off. One of the things I needed to do when I got here over a year ago was to really grab hold of the overall department and reorg. And that reorg was extremely important so that I had chain of command and that I had folks in charge of the different areas. And just currently, as a recent change we made, bringing over a part-time business manager was the last piece of the puzzle needed. So now that I have supervision in the different areas under me, now the next step definitely over the next fiscal and calendar year would be to have conversation with the city manager about having an assistant. But he is correct, sir, that we did have the discussion, a very healthy discussion, but I needed to grab hold and reorg the whole department as a whole.
And if I could weigh in on this as well, as to why the salaries are down specifically, you did mention that the number of positions has not changed, that's correct. But this is one of the departments where the collective bargaining has not concluded. So none of the dispatch positions have increases from last year to this year. Another factor is that the 53rd week component that was in last year's budget that is not in this year's budget, and it's more pronounced in some departments than others. It's hidden in other departments or masked in other departments because there are collective bargaining step increases that come into play that are higher than the 53rd week drop. In this particular budget, that's not the case. We do have a couple of lead dispatcher increases that occurred, but for the most part, the positions are the same as they were last year. There's just the reason it's down is because of those factors.
I do expect to settle this contract during the course of the summer. This has only been on hold because their union is represented by the same folks that represent the police patrol, and they wanted to settle that contract and then turn their attention to this one. So we're going to start meeting with this group in probably mid-June. I expect to be able to settle a contract with this group in the summer, and probably when you return to business in September, you'll have before you, I hope, a proposed new contract with E911, both dispatchers and superiors.
The fact that that the 911 dispatchers are represented by the same union as the police department, is that why we have a clothing allowance in there? I'm just curious as to why we have clothing allowance for 911 dispatchers.
They have historically had that. They just switched to the police union. They used to be represented by Teamsters.
Yeah, I did ask that question.
But that benefit was already in their contract.
I'm just curious how and why. I mean, are they all wearing uniforms?
So, sir, historically, when they were in Teamsters, the contract was actually cut from Public Works. And a lot of those types of clothing allowance, for example, was in there, and they negotiated it. And to answer your question, excuse me, yes, they're required to have some type of seal or emblem. We settled on that last year of exactly what the uniform would look like. And they use their clothing allowance. They actually go locally to Crazy Cats. They have a whole setup for us of our emblem, if you will. But it did originate from Public Works, because I did ask that question where this came from.
Okay.
And that was there when I arrived.
It's been in the contract
once it's
for
in
years.
The contract,
it's very hard
it's
to
tough
remove
get
something
rid of
like
it.
that.
How about a reduction? I mean, we're talking about a polo shirt that I got a polo shirt from Isabel's Cafe that I still wear, and that was 20 years ago. I mean, I'm sure those guys are still wearing theirs. You know,
I understand your point. I guess, being honest, there's no relationship between clothing allowance and what it actually costs to buy clothing. It's just another way to provide compensation to union employees. And so once it's in that contract, you're never going to negotiate it down. It's just the reality of the way negotiations are done.
Yes, you can.
That would not be a productive place to focus attention, honestly.
Okay. Any other questions? Councilor Recupero, pertinent to the budget.
Okay, I got a couple of questions. One is the stipend, it increased 100%. What is that? Is that for you to go to conferences?
No,
No.
no,
No,
that,
sir.
that's the assistant directors, there is language in the assistant directors, do you want to refer to that? The assistant directors, language for training, stipends.
There's no assistant director.
I'm sorry, the dispatch supervisors, no, not the assistant directors. Dispatch supervisors have training stipends in their language, in their contract.
Yeah, that must be combined, because I know we have a line item specifically for that, as far as.
Increased 100%. Why did it increase?
Because there are two supervisors, two dispatch supervisors that qualify for that stipend on an annual basis. There's certain criteria that they need to meet.
What is that, for allow them to go on trips?
No,
No.
no, it's training.
Training.
You can speak to that
Yeah.
more.
I mean,
Train themselves?
no, because of COVID, obviously, it's been a lot of Zoom, conference call type. Once that's relaxed, they'll go back to classroom-style training, whether it be with State 911, APCO, any of the associations, the professional associations, that they're required to have
Is that in
training.
their contract too?
Yes,
Yeah.
that
Yeah,
stipend
yeah,
is in
yes,
their contract.
actually is.
I'm just trying to find the precise language, but I'm not gonna be able to put my finger
It's,
on it.
there are several different types of initiatives that they qualify for that are overseen by the director. He assigns these initiatives if they're able to go through the training modules that are associated with that particular initiative, then they qualify for the stipend on an annual basis. It's written into their contract.
Yeah, I don't have the contract in front of me, so, but that's a contractual obligation.
And Roy already went to the clothing allowance, so that's the only thing I had. I couldn't understand why they increased 100%.
Well, now you do.
Yeah, it's a contractual obligation. I just don't have the specifics in front of me.
I have no other questions.
Councilor Lopez?
Computer maintenance. Can we use the computer guys here to repair those computers?
We do. So for personnel, we do, and Ramon's team is outstanding. But this particular line item, if you will, is for all of our computer equipment. So not only just a traditional computer that they may use for email, this goes toward the radio system computer, the fire alarm system, the computer-aided dispatch. All of that stuff now is computerized. So it could go from keyboard and mice type of equipment, just the hardware, all the way to software upgrades.
And also radio purchase repair, $40,000.
Yeah, and to be honest with you, sir, that's probably one of the most important line items. And we go through that, last year we did, and currently I'm just about to use up what's left of the funds, because my responsibility, or the responsibility of the overall department, is the police, fire, public works, and emergency management radio. And not so much the radios they talk on, the actual radio system.
Councilor Recupero, last question.
Yeah, my last question. Why are we paying $3,000 for vehicle maintenance when we just bought you a car?
So that goes toward oil changes, tire upgrades, any of that type of equipment toward it. And my understanding is that's recently been used now for the WEX program for the fuel card. And that has to be paid in advance. So we reduced it immensely, obviously 5 vehicles down to 1 for fuel, but fuel, tolls, all of that stuff comes out of that account.
So that's fuel and oil and everything is under that?
Everything, yep.
But over here, you've got gasoline, $3,700. So how's that go under? If over here, you've got gasoline.
Oh, wait a minute,
We'll take
Yeah.
a look.
No, I apologize. The vehicle maintenance is all of those minus the gasoline. I apologize. Now, the gasoline, what's important about that, that's just not WEX for the vehicle. That's also for the generator that we have. So under the emergency management side of the house, I've got a grant purchased from UASI, a very large generator, that obviously takes diesel fuel. We use that, for example, for 3 months in a row during the quality in the COVID housing. So all of those, and other smaller equipment that we have, portable light towers and stuff. So anything that takes fuel will come out of that budget.
So, and to your point, Counselor, about the fact that it's a newer vehicle, I'm noticing that the expenditure total on the vehicle maintenance line is about $1,400 to date against the $3,000. We still have 2 months to go, and there may be other repairs, but
Yeah.
we may have some surplus this year, and in the early years of a newer vehicle, that's usually what will happen.
And actually, not to defend the vehicle, but
Yeah.
the vehicle was actually purchased probably about 3-4 months prior to me coming. It did sit for a while, and then, of course, I acquired it when I got here.
So it looks like we'll have some surplus this year. I'm not sure about what will happen in '22.
All right, thank you.
You are now responding to taking greater responsibility when there are emergencies, displacements such as fires and such. Can you talk about a little bit about how your role plays in assisting families or any other victims of any emergencies that happen in the city? Because, again, this was something that seemed to have been some sort of conflict with prior emergency managers and what may be happening now. So can you explain to us what is the current mandus operandi when it comes to a fire and displacement, and who's helping families and who's putting them or assisting them with Red Cross? And there's a lot of confusion going on. So you can tell us what happens?
I can. That's a very good question. So just to start at the beginning of that, what I put together when I first got here was a matrix of the dispatches of what I would be called to for emergencies. So right off the bat, they know what type of events that I would need to be called back. So one of those, for example, obviously would be a fire, commercial or residential fire. Already twice so far this past year, we'll say a few months, I've been called back by either dispatch or the on-duty deputy chief for displacement issues. So one of them happened to be downtown Broadway. An apartment building had a major gas leak. So we had about 3 families that needed to be placed somewhere. Red Cross, we notified kind of as a standard procedure within emergency management. There wasn't much they really could do with COVID going on. They restricted in this particular because it was a small case. So I talked to Tom on the phone, and what we did, because we do have a setup with one of the hotels in town, was put them up at a hotel, or just for the one night, just for the initial night. And that worked out well, very appreciative. And we have a deal with the hotel, very, very inexpensive. It was like $80 a night. So that was one particular scenario. Another one that I got called back for was a few Sundays ago when the truck hit the building on Lower Broadway, and there was folks displaced. On that one, I assisted the deputy fire chief with those displaced folks, but we didn't have to take action on the city end because of the way the condo association dealt with it. They had actual funds to put each other up, so we just facilitated and helped them out. But yes, to answer your question directly, any of those type of incidents that happen, where there are going to be displaced families, sheltering operation, you name it, I'm called. I have a very good relationship with both police chief and fire chief.
Okay.
And there's no conflict at all. Chief Albanese and I talk quite a bit about it.
Displacements, would that also be, that's not relative to, say, a fire or a gas leak? Could be any sort of car running into a building and making the building structurally unsound. Again, would they call you down once there's the displacement and so forth? Okay.
Yep, and that's exactly what happened that Sunday.
Okay. Yep. Any questions? No? Okay, thank you.
Okay.
Thank you very much.
Thank you. Okay, thank you. See you, Tom.
All right, thanks, Steve. Police Kai's, Chief Kai's the last one, and this is page 83.
I think we need another chair because I think Lydia's with her.
Oh, okay. 83, yeah.
Bacardi and Coke. I wish.
I've been up here.
He looks good.
You know, you were ready to get green lighted with the budget until you brought her. Now you're gonna have problems.
Well, we'll see.
83.
83, sir. You're not wearing your headphones. Come on.
Okay, so I'll leave mine here.
I'm gonna get the cones that use for dogs.
And they've been focusing on all of these
All of the salary information is on page 86.
Unless it's too late for them to do it, we don't know, we'll see, but I'll leave it here for you. Been asking a lot of questions. They've been asking a lot of questions.
We have two listening.
Okay, listen, okay.
Judith and Naomi are watching on Zoom.
Oh, great.
Plus, we're on Facebook Live, so say hello to everybody.
Okay, sounds good.
Look much different than I see you in the morning.
I know, you too.
Most of them aren't, they asked me not to, so they can speak clearly, but I don't care what's wrong.
Okay, Chief Guys, the floor is yours. You can make your introduction and opening remarks.
Sure, just by way of my opening remarks, certainly I know everyone here. My name's Brian Kais, Police Chief. Been working for the department as of 34 years last week, Police Chief the last 14 years. I'm proud to represent certainly the men and women of our department and I think the phenomenal job that they do day in and day out in keeping our city safe and secure, in working with folks like yourself in city government, with our local nonprofits, with many other stakeholders, and of course our residents to address the issues as they pertain to public safety. We're here this evening at this late hour, at this point now, but certainly to talk about the budget that we've submitted on behalf of the city manager to fund the programs that we have, to fund the salaries and other operational services. But I'm here certainly to do my best to answer any questions that you have pertaining to the budget or any other issues pertaining to the police department.
If I could, I just want to remind the councilors that the budget that you have before you reflects salary increases for superior officers, their new salary based on the contract. It does not reflect raises for the patrol officers. They've approved the contract. It'll be before you on June 7th, but it's not reflected in these numbers. Those increases are in the salary reserve account.
And in addition, I'd be remiss if I know you guys know Lydia, but Lydia certainly worked for the city council for many years and has been an incredible asset for us at the police department as the business manager and grant administrator. And I certainly draw from her experience often, and she's definitely, like I say, I know we stole her from you. I apologize, Roy, I told you this before, but your losses are gains, so she's here tonight to assist me as well.
Chief, opening question. You don't have to go over the whole list of the goals and initiatives, but what specifically in the budget would you say is may have changed that is allowing you or you're looking for to help you in meeting your goals and initiatives?
So, I mean, the staffing is the same as the current fiscal year. As far as program, I guess I might as well mention at the outset. So one of the things that we were looking for in the budget was to fund a mental health clinician. Honestly, I think it was a year ago today, we actually brought this up at the budget hearing last year. And I had mentioned how important I think this position would be as an evolving best practice. Much of what we do in policing, in addressing individuals that are in crisis, has to do with people that are in crisis because of whether it be substance use or mental health issues. And I saw the significant value, I and others, that existed in bringing an individual in for this particular position. So I had put it in the budget with a certain dollar amount. But What I also did is applied for funding through the state for a grant, and we are optimistic that we will receive funding, and we will not need that money in the budget. So initially, that would be something new, but now basically what I'm presenting to you here tonight, I just spoke to the city manager in the hallway, that we will not need that, I don't know what's the exact amount. 75. We will not need that $75,000, because that's certainly important, to have an individual that will work 5 days a week, that'll work a couple days and a few nights, kind of a flexible shift, to work alongside of our offices, to go to different calls where people are in crisis. What we do, matter of fact, the money will be coming from, when I say the state, will be coming from the Department of Mental Health. We rely on them now for grant funding, for training our offices in different types of training, one of them called Mental Health First Aid, which is an 8-hour training the whole department receives, but more specifically something known as crisis intervention training, which is a pretty substantial training of 40 hours. The state pays for that. The state pays for the backfill of overtime that's necessary. And again, it's just very important because this is what we deal with in the inner city departments, responding again to these people in crisis.
You look at the department at a glance paragraph, and of course, you're seeing the changes, calls for service.
Yep.
Total rest, all of that dropping.
Yep.
And some would say that it's both a reflection of COVID, but also has been a trend, not only locally, but maybe nationally, a drop in crime. But specifically, one that came to my attention was the motor vehicle accidents. If you're looking at, which is always around the 900s or 872, but basically around 900, that difference of almost 250 different accidents, would you say, at first glance, I was like, well, maybe it's COVID. Obviously, there was a lot less traffic going on, less people around, but could you make a statement that it's anything other than that, and that basically the streets of Chelsea are and the configurations are the which they are, but once we get back to regular traffic patterns, regular traffic counts, however, those accidents will once again occur? Or do you think something happened other than that?
Yeah, no, great question. And because there is a significant decrease, as you pointed out, pretty much the numbers over the past 5 years were fairly consistent. I would say, you mentioned it, and I would just kind of back up what you said. I think certainly the number of motor vehicle traffic in general over the course of the past 12 months has been significantly less, certainly going back to mid-March, throughout the course of the summer and into the fall, just in general. I'll be honest with you, and just traveling around recently in the past 2 weeks, traffic has just come out of nowhere. And then prior to that, you could go wherever you're going to go, any one of us. Pretty much all the major thoroughfares, including the streets in Chelsea, were pretty wide open. So yeah, I think it was just a direct reflection of less motor vehicle traffic on the road. Certainly, some of the proactive steps that have been taken over the years, and I think I might have talked about this in the past, but I'll bring it up again. One of the most dangerous intersections that we have, and I think we all know, one of them we talked about, Broadway and Congress, Broadway and 3rd, has been a problem for a number of years, but even the top of Park Street at the intersection of Hawthorne and Central, that has always been a problem, at least for motor vehicle accidents pertaining to pedestrians. And what we did some years ago, and it's reflected in the overall data, the number of pedestrians that have been struck by a motor vehicle at that location have gone down to 0, when it was as high as 15 at one point in time. We did a lot to eliminate traffic from cars from being parked on the left-hand side of the road, clearer signage in that area, certainly enforcement, things like that, better lighting, even with the delivery trucks that will park on the left-hand side because it's a quick delivery to run in the stores at that location. And we let them know that, listen, we understand what you're trying to do, but we need you, we can't allow you to park there because, as you guys probably realize, the crosswalk, 2 crosswalks, one at the top of Park Street and one at a little bit further on past the stores that connects on either side of Hawthorne. It's at the top of Central. That if a truck is parked there, there's a blind spot when someone is coming out, and people are looking left and right into traffic, and there's a lot of accidents. So that's kind of one example of some of the measures that we've taken collectively with DPW with other partners to ensure that when we find a problem, what we perceive to be a recurring problem pertaining to traffic, we take proactive steps to address it, and then we certainly measure the data over periods of time, and we see a reduction, and we know that it's working. But honestly, because 2020, the number of accidents has decreased by over 20%, I think the leading reason for that has to do with less motor vehicle traffic because of the pandemic.
I don't have any more questions, but I just want to make an observation and ask your department to be aware and pay attention to this. The last couple of weeks, I have noticed on off hours, because of the new street configurations and the, I would say, the narrowing down to 2 lanes on particular like Everett Ave, on days that I normally have never seen. I'm not talking about weekdays, Monday through Friday, but for the last Saturday and Sundays, I have seen a backup of traffic on Everett Ave from KM all the way to the intersection of Broadway. And this is not because due to a bridge being up or whatever, which you would expect, but no, just all of a sudden that street has been narrowed. And I know there are other streets that have been narrowed. The mentality I'm afraid of, and I've spoken, kiddingly to colleagues and to other people, it's like, I'm not used to seeing this. I'm gonna have to start jumping over, down 2nd Street, because I know the streets of Chelsea, I know which streets, I normally could just go up Everett Ave, no problem, but now that I see that there's traffic, it leads me to start using the secondary streets, and also, like many, I'm not the coolest head, but I also, it's a level of frustration. My concern is, A, cut through traffic that's gonna start to happen on these secondary streets, and 2, hotheads, which lead to more accidents, which is why this number is jumping up. I think now that we have all these new configurations, we're gonna lead to road rage incidents and such, so I would just say, maybe have your staff pay attention, because we may end up seeing a lot of this speeding on the sideways, and I may end up having a fatality, hopefully not a pedestrian one, but because there's the backups are starting to occur. So I would just, bring that to your attention.
No, fair point. And like I say, we're all out there, we're all traveling. In the last, we'll call it the last month, traffic everywhere has definitely increased. And I think even with the governor making certain announcements as far as scaling back on some of the restrictions and so forth, people are just coming out of every location. And we're seeing it, being in the inner city and being a cut through to Boston, absolutely positively. 2nd Street, Everett Avenue, they're definitely backing up. You yourself, after many years of experience as a police officer, but also your men, that a normal summer always brings out a certain exuberance among human behavior. Sure. Yeah. And I fully expect, Las Vegas type of behavior all around here, because they're going to be able to go out and finally be out and about. So I expect that sort of mentality, craziness mentality to happen this summer. It might blow these numbers out of the water, but it should be expected. As do we. Yeah, we're trying to really prepare, certainly.
Councilor Brown.
I'm just going to add on to that. A few weeks ago, we had a meeting. Most of the councils were not excited about what our endeavor is. We'll be taking over Eastern Ave. The state is returning Eastern Ave to us, and we feel that, there's a lot of responsibility. It's actually going to be a city road now, city street. And we just want you, not only, as Council President stated, with the Eastern Ave and the 3rd Street in Congress, a lot of these, Broadway itself, the other day I was coming down Broadway and I heard one of the fire engines come down. And folks, for some reason, they still stand still when fire trucks are getting by. And I know the maintaining of the street will be our responsibility, but we also foresee a lot of speeding, a lot of traffic, a lot of cutting through. going over the bridge, coming from East Boston, coming from Winthrop. So we just want you to have that on your radar. I'm not sure, maybe the city manager can tell you exactly what date or what time of year we'll be taking full responsibility of that. But we know it's going to be on our plate, and we see the traffic pattern changing because of the narrowing of the streets, and also the bike lanes, the bus lanes. So folks are really concerned about that.
Well, I know, I mean, and I know I'm preaching to the choir in this, but certainly Eastern Avenue has always been a quasi-city street. I mean, you know, Chelsea Police, and we've always obviously patrolled Eastern Avenue, but I know it's been a quote-unquote state highway for purposes of certain accidents. The state would come down. The state never patrols Eastern Ave, like they never have ever, other than passing through. But yeah, of course, we will definitely, you know, maintain the level of presence and visibility that we always have in that location.
That's it.
Councilor Robinson?
I know we had some retirements in the police department. Do we have any people in the academy?
We currently have 3 officers in the academy scheduled to graduate the Randolph Academy on August 5th. And you know, the sooner we get them, the better. Certainly, we have 4 officers. Well, we have 4 seats that were slated for the Transit Academy in mid-July, subject to certain qualifications that these individuals have to go through. Hopefully, we get 4. But we just lost 2 officers that resigned this week that went to for greener pastures with the state police. In their opinion, but and we have other officers that are, a good number of officers that are certainly over 55 years of age, have more than 32 years of service, are eligible for a full pension, and they're looking at their own personal situation, and they could leave really at any time. So you know, we're monitoring that as well.
All right, thank you.
You're welcome.
Councilor Recupero?
Okay, 000 everywhere. The only one that sticks out is this one. Dues and subscription, 187.5%.
Let me look at the number.
That's that new,
It's the certification.
that's the new certification you want.
Oh, okay. Yeah, so, yeah, thanks for bringing that up. So we are one of 95 police departments, including college police departments, that are accredited, fully accredited by the state. There is something under police reform. Right now, there's going to be a commission, a new commission's been named, known as the Post Commission, Peace Officer Standards and Training. They're going to have their own certification that police departments are going to have to maintain. What we want to be able to do in Chelsea is demonstrate that we are truly ahead of the curve on any and all certification and accreditation. So we're looking to be accredited on a national level. Right now, we have a handful in the state, there's a handful of departments that are accredited by an organization known as CALEA, the Commission of Accredited Law Enforcement Agencies, a national organization. This is something that, based on the policies that we have right now, something that is within our grasp to attain. So like anything else in some of these organizations, there's a fee. That's the significant fee. What we're trying to do is find a way to mitigate, potentially or possibly mitigate that number, and look for lack of a better term, a bit of a discount, which may be available to certain cities of our size, based on what happened with the loss of revenues in various cities like Chelsea, and we'll see if we can work something out. But if not, that number is reflected in the budget, is in fact the fee. So that's why there's such a bump. Okay.
Councilor Lopez?
Thank you for coming. Can you explain me what a student office means? Are they working or are they just?
Explain what they are, student officers? Yeah, so it's a statutory designation of office of individuals. When an individual is attending the police academy, they're known by statute as student officers. That's their designation, and once they graduate, they will be sworn in the city manager's office, and then ceremonially at some point before the city council, they become full-fledged permanent police officers. But right now, during the course of their 21, 22 weeks in the academy, their official designation is called a student officer.
So right now you have 4?
Right now we have 3 in the current academy.
Thank you.
One must be vacant. One's vacant.
One is vacant.
So 3.
Any questions? No.
Three, with one vacancy.
Final question, Chief. We recently, Councilor Taylor actually pushed forward the new fireworks code, the violation, and with that, a fine. Talking about the earlier mention of the exuberance that we expect to have.
Sure.
And what we possibly will have is another summer full of people who maybe, wanted to play around with fireworks. If I read social media, with the announcement today in social media on the city page, there was a lot of scrutiny and cynicism by residents thinking that there really isn't going to be any sort of enforcement, noticeable enforcement by the police officers. Can you touch upon that to say that knowing there's going to be some exuberance, knowing that there was a lot of criticism about the level of fireworks that were put off last year and hopefully not repetitive this year, that this may be something that your department is already aware of and is ready to address?
So nobody was more frustrated with the fireworks, certainly the residents, and trying to sleep at night, obviously, but the police officers that were out there working day and night, and obviously mostly into the overnight hours, than the police officers having to respond to these calls. We had many areas of the city that were impacted, and Councilor Taylor remembers this. We had talked about Bow Park and keeping the lights on at night, assigning officers to various locations to make sure that individuals weren't congregating and lighting off fireworks and doing different things. It was frustrating. I hope it's not going to be as frustrating certainly this year, but we all know, I'm not going to kind of go back in history, but last year, in 2020, was very challenging for a lot of reasons. Certainly challenging at levels for law enforcement like have been unprecedented. I know that the officers, and a lot of this never really came out, but just to mention it, a lot of officers responding to various locations for individuals lighting fireworks were met with all kinds of remarks, with harassment. Officers are responding to calls because neighbors are upset they can't sleep. Officers are there not to harass people for having a good time, but saying, listen, this is illegal, and we can fine you. We don't necessarily want to fine you. You're residents of our city, but you can't be doing this. And there was a lot of phones that came out, a lot of recording of police officers trying to do their job, a lot of pushback. I'm hoping that and again, there was very challenging and difficult times last summer. I'm hoping that doesn't happen again. Certainly, I'm aware of the fines being increased. We always want to utilize fines, as we can imagine, as a last resort. We don't want to run around with ticket books and just kind of write tickets till they're going out of style. But that is something we're certainly prepared to do. And I know that I believe the first offense now is a monetary fine as opposed to a warning. We're going to utilize discretion within reason, certainly, but this is serious. It's not just Chelsea, it's all over. Certainly I know that the fireworks have started where I live already, and I have two little dogs, and believe me, it's tough to get a night's sleep with fireworks going off at 3 o'clock in the morning, but we will do our best, we will do our darnest, we will definitely take this extremely serious. We do other things as far as even not just that night, responding to a call, and the city manager is well aware of this, and as of some of you certainly reaching out to me, we'll get these locations. We have residents that are very interested, very engaged. They'll give us addresses where these fireworks are apparently coming from. We'll knock on doors during the daytime hours where cooler heads will prevail, hopefully. We can explain to people what the problem is, and we have someone that I'll call out and give kudos to someone like Sammy Mojica, who does a phenomenal job in engaging and using his conflict intervention skills to kind of broach these areas with the folks and really try to come to some agreement. And hopefully this year, as we approach July 4th, will be nothing like last year. But I'll certainly continue to solicit input from any of you that have any suggestions as we move forward, and certainly my boss and his team to address this issue on an ongoing basis.
Last question from me. I never thought about this before, but I'm just curious. Was there any interference with the fireworks and the technology of recognizing shots fired in and around the city? Did that ever trip?
Always.
Always.
Always. And that's why, the shot spotter technology, and it is fairly accurate. But there have been times when, it's kind of a long story, but there have been times when things were held back because they were classified as fireworks. And it got to the point where, unless it was incredibly obvious, I said, give us all the alerts. Let us determine on scene whether in fact there's fireworks. Not to mention, it's a good thing if no residents call for fireworks. We're getting a shot spotter alert in a given location that there's a loud noise, sounds like gunfire, could be an M80, could be other fireworks. Let us investigate, let us hold those accountable that are responsible and stop. So yeah, we always, especially July 4th, it's almost like the shot spotter technology in many parts of the country is turned off because it's fireworks as opposed to gunfire, but certainly it could be gunfire. I say that facetiously, but we want to get all these alerts so we can investigate and make that determination for ourselves.
Okay. Thank you. Counselor Taylor.
Thanks for coming in, Chief. And I appreciate everything that you did last year. I know we're in close contact about the whole issue.
Yes.
I just want to say one thing about this, and that is that I think, this is not me, I have every confidence that both you and the city manager are taking this very seriously and intend to enforce this new ordinance, but there is an abundance of skepticism in the public. And so when I talk to people, and I've got people all over the city calling me, not just people in my district, you know, there's just a real skepticism that the police will enforce this at all. And I know that in the last public meeting too, you know, there was an issue too about, and I know this isn't your domain, but the you know, that not all those calls last year were being dispatched. And so I think people just, they need to be, I think, reassured by the city that that something different is going to happen than what's happened in the past, because the vast majority of people that I talk to are very skeptical. And it's like, I think that if we can, you know, if we really want to change something, I think we should change it, or try to change it. And I know that not everything is necessarily changeable. You can't just, you know, snap your fingers and have the problem disappear. But I think if people see the city making a very honest effort to try to you know, combat this problem, that'll go a long way in, you know, public trust for, and I think that that's something that both the police department and the city could really use, a good dose of public confidence, and I think that this is a way that we can do that, because, you know, and I know that there's other, you know, you guys have other fish to fry, I get it, but when so many people are affected by this, and so many people can't sleep, and, you know, they're whatever, we've gone through the litany of problems that this has caused, but you know, it's something that most people can relate to, and it bugs them, and that you know, that a few people in the city feel entitled to do this. It's not fair to the vast majority of, you know, hardworking, you know, people who just want to get a good night's sleep so they can go to work in the morning and pay their bills. So, you know, I would just put that out there for you guys. I have every confidence that you guys are going to do everything that you can, but I'm just giving you a heads up as to what's out there. So,
well, you know, just to respond or to speak on that, so I mentioned a bit already, but you and I, we had quite a few conversations last year on this issue. I know that we know that, you know, fireworks certainly were not unique to Chelsea, meaning this was all over. I mean, it was on the cover of the Globe, the cover of the Herald. I forget the exact headline, but it was crazy all over. It was on all the media stations. The city manager and I know Director Staffia was just in here, we've met on this already. The city manager was very specific, it probably came up in the previous hearing, I'm not sure, but for every single call of a firework that is ignited, that comes in for dispatch, to give them all out to the police. You're not doing anyone any favors by holding back and say, well, it's just fireworks. I mean, obviously, it's that much of a nuisance, certainly. And again, I'm hoping, so that wood around here, knock on wood, that last year was an anomaly as far as the level of fireworks that were generated around the Commonwealth. But it is, it's a quality of life issue. We all need sleep. And certainly, not to mention, if the fire chief was here, he'd say, well, chief, don't forget, these things cause fires, and they can burn down neighborhoods, and people can get hurt really bad. So it is it's a nuisance, certainly, but it's also a public safety issue, one that we will certainly, you have my word, continue to take very, very seriously. And again, I mentioned it already, but I'll definitely work with all of you with any continuing suggestions that you might have. And I want to certainly assure the residents that are skeptical that this will be, certainly during this time of the year is when it happens, one of our #1 priorities. There is a new ordinance, there is a substantial fine, they will be imposed to those that violate the law. Folks that are skeptical, I mean, I could be a little bit defensive and say based on what, but I won't. I'll just say that I will assure the residents that we will continue to work on this issue to make it as quiet as we possibly can.
Thank you, Chief. I really appreciate that.
I'll just reiterate, I mean, I've had conversations with the chief and with Steve Stafford that this is going to be taken seriously. I expect every dispatch call every call to dispatch to be sent to the police, and if we get reports that a call was made and the police weren't notified, I'm going to follow up on that with dispatch, and there will be discipline issued. Dispatches Steve's been instructed to inform all E91 dispatchers that every call for fireworks is going to be sent to the police department for a response. Now, I imagine there will be instances where a response is delayed because the police are engaged in, higher priority responses, but they are to get every call so that I can track, if there was a delay, we'll be able to track. Why was there a delay? Okay, every car was tied up and another serious situation, understood. But the message has been sent to both department heads that this is to be taken seriously. I certainly hope that this is a better year than last year for all of our sakes.
And I just wanted one other comment, I'd be remiss. I know there was a public safety subcommittee meeting that was called, and I was not in attendance, and I had a resident that I deal a lot with, and is very engaged, and she said, she was very nice, but said, Chief, I'm very disappointed that you were not there. And I was kind of notified last minute, and I did have an engagement over at Bunker Hill Community College. Otherwise, I would have been there, but I know you and I have talked offline, and again, my full support on this very important issue. Okay.
I just want to thank you. We had a lot of calls up and down until, and Sammy Mojica, you gave me his number, and we initially in our subcommittee, we also wanted to do some education about just letting folks know and how serious this was going to be handled and this was going to be a priority. But I also spread the news that Sammy Mojica is always available once we get those numbers and names of some of those residents that will want to help out. Please let the police handle it. I know some of the folks try to handle it themselves, but it's a dangerous situation. But I just want to thank you for always returning my phone calls. And I remember you telling me about your neighborhood also. And I know it was a horrible experience last year, and I think it had something to do with a lot of other stuff. And so far this year, I've been listening for it up on the hill.
Yep.
And we haven't heard too much of it, but it's still early. So, just want to know, the residents to know if they're watching, that we do have a communication person, Sammy Mojica. He would actually come to your house and talk to you and keep you out of the picture and deal with those addresses that you give him, furnish him where you believe some of the activities stemming from. So thank you.
Thank you.
I do have a note here from Councilor Zabit also, although she's watching remotely, also said she wanted to thank you for your work. She unfortunately had back surgery and is out of, but she's listening, and I just wanted to make sure that that message was sent to you.
Thank you. I certainly hope she's recovering at home well.
Any other questions? Seeing none, it's been late at night. Thank you very much, everyone, for your attention. Sorry for keeping you so late.
No problem at all. Thank you for your time. Appreciate it. Thank you.
Daddy, I know that lady from somewhere.